Just think about it. Life in Kingston Town. Life in Kingston Town. She calls out to the man on the street. NigerPhoenix.com. Sir, can you help me? It's cold and I've no place to sleep. Is there somewhere?
Entitled to courtesies. But I look behind you and I've seen so many of our former colleagues that I feel enlightened, notwithstanding the very bad news we've had this afternoon, which have disrupted our thinking and our mood. We will still strive to make this as practical as possible. If you ask me, your coming at this time is actually in good time because we're worried about emergency care, but we'll get there. For now, we want you to tell us a little more about yourself, and then your colleagues, former colleagues, will ask you questions relating to the ministry you've been nominated for.
Mr. Chairman, let me thank you very much for the warm welcome. Let me thank the rest of the members of the committee. I'm happy to be back in Parliament, and I would like to take the opportunity to thank all the traditional leaders who have come to support from the Greater Accra region. Let me also thank the Greater Accra Caucus in the New Patriotic Party. I see other members of Parliament, Honorable Tina Mensah, and some past members of Parliament as well. Let me also take this opportunity to thank His Excellency the President, President Nana Addo Dankwa Akufo-Addo, for the confidence, and I thank God Almighty also for the promotion. So I can only be full of thanks.
Honorable, they say, tell us a bit about yourself.
I wanted to show gratitude. All right. So
what are his gratitude? Yes.
I am 100% Teshi gentleman, both parents hailing from Teshi. Born in 82, started my kindergarten in the Military Academy Training School, Maths, and then continued in the same military environment at the Field Engineers Basic School. I completed in 97 the basic school and continued to presec Legon. I pursued science and left presec in 2000. 2 years later, I started medicine, study of medicine in KNUST. And from 2002 to 2009, I finished my bachelor's in medicine and surgery, as well as bachelor's in human biology. And so I started working as a young doctor in 2009. And after finishing my house job, I went to do my medical officer posting at the Chebi, or some people call it Kibi Government Hospital. So I was in Kibi from 2012 to 2015, when I came close to the constituency because I had gone into politics. I was the candidate for the New Patriotic Party in Lejikuku. So I came to La General Hospital and worked in La in 2016, early part of 2016. And then, I think 3 months to December, I went on leave without pay so that I could have the space to do some canvassing. Let me quickly mention that whilst in Kibi, I took the opportunity also to do a master's program in Hamburg, Germany, in public health. You know, in the village, as we call it, when you're a physician, you work 24 hours a day, 7 days a week. So one of the privileges is that sometimes they are flexible and allow you to study. So I combined my medical officership with the master's program. So in 2016, I was a candidate in the elections. I was a parliamentary candidate for Lejikuku constituency. And by the grace of God and with the support of the good people of Lejikuku, I was voted as the Member of Parliament to represent the constituency on the 7th of December 2016. So I got sworn in on the 7th of January 2017 as a Member of Parliament and worked as a legislator from 2017 till 2021, January 7th. Whilst in Parliament, I got the opportunity to serve as the board chairman of the Korle-Bu Teaching Hospital. And then, at the latter part of the first term of His Excellency President Nana Addo Akufo-Addo, I was privileged to work as a deputy minister at the Ministry of Health for some 7 or 8 months. After 2020, when some people took my seat away from me, I did some pro bono work in some hospitals in Ghana. And then somewhere in 2022, I got an opportunity to serve at the National Health Insurance Scheme as a CEO. And Mr. Chairman, life was in a stable state at National Health Insurance Scheme until this appointment to go to the Ministry of Health as a sector minister came. So in summary, Mr. Chairman, that has been my journey to this place. Thank you very much.
I noticed you didn't greet the First Lady as you used to do every morning. Well, why?
Honorable, you stopped him halfway, so in the course of it, it will come, don't worry. Yes. Colleagues, this is Dr. Okoe. Doc, before we start, the bad news we had was that we lost a member of parliament. He was also a deputy minister. He lost his life in transition. What it obviously suggests that he must have been an emergency in the course of his travel. Now, looking around the country, what do you assess the state of emergency medical practice? What do you see as how are we prepared to deal with emergencies For example, the major highways, Accra, Kumasi, Accra, Takrade, Kumasi, Tamale. If there's an emergency, not trauma one, medical emergency, do we have any facilities we can count on to respond to that?
Thank you, Mr. Chairperson. What I would say is that the structures in place for emergency medicine, we have some fairly good structures in place. I think what we can improve upon has to do with the management of these structures. So, for example, if you look at the ambulance service, yeah, they have leadership in the regions. In every district, they have an OIC officer in charge. But most of the time, things like logistics, fuel, some discretion, they are limited. So if you get an allocation for fuel and in the course of the month, your allocation runs out because you had more referrals than your neighboring district, you might have to ride through the bureaucracy to the center before you get support. I think what we can do is to find a way to give some discretion and power to the local authorities. So a DC must have some role to play when it comes to delivery, emergency service delivery. A DC must know whether the ambulance station has sufficient fuel. Assuming the worst case that before the month ends, the allocation runs out, there must be some liquidity or some sources to support them. And so I think that what we can improve upon is the management of the process. I have seen emergencies being handled at Chebi, our hospital, district hospital. I have been part of emergencies that have been referred to in Sawam Government Hospital. When cases get there, they do a fairly good job. But sometimes it is, again, the proactiveness of the one who is heading the facility to make sure that those who are at the emergency are alert and will come to a patient in distress and not wait to be approached. So some of these things have to do with management, some level of autonomy, decentralization. If we do that, as for the personnel, we are lucky. We have very good personnel in the system. Thank you.
Yes.
Thank you, Honorable Chair. Congratulations, Honorable Okoe. COVID-19 vaccine management in terms of procurement and distributions were some of the major challenges for government during the COVID-19 pandemic. According to the Auditor General, by June 2022, over 1 million COVID vaccines had expired at various district and regional offices. As if this was not bad enough, the Auditor General on page 12, paragraph 34 of the reports of 2023 indicated that about $38 million worth of vaccines were procured. We have not received the vaccines. We have not received our money. What will you do if you get a nod to become the minister in charge of our health? Thank you.
Thank you very much. Mr. Chairperson, my attitude when it comes to COVID, how we managed it as a country, because I was privileged to be part of the process, I always say that we had a lot of successful stories, high points, and there were a few things also that could have been managed in a better way. I know that our infrastructure for vaccine deployment is one of the most efficient in the sub-region. And that's why during COVID, some countries actually gave their vaccines to us because we had a system to deploy quicker than them to prevent those vaccines from getting expired. One tricky thing about vaccine deployment is that no matter how efficient you are, because of the short shelf life of some of the vaccines, you can be caught in a trap where a few or some would expire with you, no matter how fast you try to deploy them. It's unfortunate, but we can always improve on the system. Although the EPI, that's the unit that handles vaccination, is very celebrated in our African continent, they can still work on perfection. So going there, we'll try and work closely to see how some of these things can be avoided in the future. That's for those that can be avoided. When it comes to monies committed or paid without vaccines in place, fortunately, most of these agencies, like AVAT, Gavi, those agencies we deal with when it comes to getting vaccines, they are the same people that help us with our traditional vaccines as well. Those ones we give to kids, and the ones for adults for disease that can be prevented. So, Honorable Mr. Chairperson, we'll try and sit, once there's a record that our money is with an entity that has not given us what we have to get, we can sit down and see whether we can reroute some of these funds to vaccines that we need, because the program runs continually, talking about the traditional vaccination for kids, meningitis vaccines and all that. I'll work hard to make sure we don't lose out. Nobody takes our money and just takes it without delivering service. We are going to work on that. Thank you.
Thank you. Still on COVID and Auditor General. Paragraph 113 of the Auditor General's report 2023 on COVID expenditures reports that although payment of 10 million cedis over was made as premium for special life insurance cover for about 10,000 health workers and allied health professionals in 2020, only 418 out of the 6,961 workers have received their packages. They've placed their requests at the insurance. They actually qualify for it, but they have not been paid. A case in point is when we went to Holy Family Hospital in Techiman. The health committee went to Holy Family Hospital in Techiman and were told that even though some of them were affected by COVID, they contracted the ailment, and then they have placed their requests, they have still not been paid. What will you do for these nurses and doctors when you get them not to become the minister responsible for health, to help them to retrieve these monies from the insurance company?
Thank you very much. Mr. Chair, so when this policy was bought by the government to cover frontline workers, I happen to be at the ministry as a deputy minister. I am aware that the policy had some ingredients. What it will cover, the kind of health worker you have to be in terms of being frontline or not. There ought to have been some vetting to make sure that the fellow is a frontline worker as claimed. And I also know that there was some level of capping, as in the policy was not going to handle, let's say, 10 million people, assuming they all were part of the process. Now, what I want to make sure happens is that once we committed or we bought this policy at a price, the ingredients in the policy, reference those he had to cover, should be exhausted. So that if the policy says that it could cover a maximum of 50,000 workers, it means that we would find a way to vet frontline workers up to that tune and make sure that the right thing happens. They are covered, or they get compensation for their work. One interesting thing was that during the COVID time, a lot of people started to show how frontline that they were. It became a little bit of a challenge because almost the entire workforce more or less became frontline. But suffice to say that we still have people who can easily be identified, like those who worked at Kwabenya, at the treatment centers. Those are explicit frontliners. So, Mr. Chairperson, we are going to look at the policy, see its ingredients, and make sure that we get value for money from what we bought.
Honorable Okoe, you keep referring me to as Mr. Chairperson. Do you have any challenge identifying me as a man?
Mr. Chairman, I'm sorry.
I'm a chairman. Yes, we may proceed.
The more reason why I think the LGBTQ plus law has to be signed. Anyway, on a lighter note. So once you have undertaken to take this matter up, I'll save you the follow-up questions and go straight to my last question. You have barely 9 months to work. What are some of the things you intend doing effectively within this short period? Thank you.
Thank you very much. I think quickly, there are some two things that I consider to be low-hanging fruits or can be done pretty quickly. First of all, having served at the ministry as a deputy minister some few years ago, I know that there are a lot of projects that this government or the state has committed itself to. Projects that have either been completed or are far advanced. What I realized that we've not carried the communities that host these projects along that much. So you don't feel the nation coming along with the plan of the ministry. But what I want to do is to engage more the stakeholders that are hosting some of these projects and make them feel part of the project so that whatever we have to do so that those projects become functional and beneficial, we do that as soon as possible. I know a lot of projects that are up. Sometimes you talk to people who are living just meters by the project and they tell you they don't know what this is about. That is not too correct. So that is one thing that I want to carry the nation along. Secondly, as a clinician or someone who's worked in the hospital or visits the hospital, what people used to judge the quality of our health system is the experience in the hospital. So I want quickly to improve the experience that we have, especially in public hospitals. And I believe that can be done. For example, since independence, I stand to be corrected. If you want to see a doctor in Ghana, you have to go before 6 a.m. and go and queue. You don't know whether you see the doctor at 9 or at 1. It is not above us as a country to have this appointment system. So that even the one in the village will be able to get a cheat that shows that you have to come around 11 a.m. because your doctor will be around from 11 to 1. But as we speak, if you want to see a physician in Ghana or a prescriber, whether it's physician assistant, a midwife, you have to go to the clinic before the sun rises. And it takes a lot of time. That makes people shy away from the hospital. I believe we can improve on this experience. And then they say the eating, the taste of the pudding is in the eating. We as managers of the system, the health system, must be part of the system at where it is delivered. I want to be a sector minister who goes to facilities to see what patients are going through and to see what we can do to immediately improve their experience. Once we start doing that, people will be happy with leadership, both at the health ministry and in parliament. Thank you.
Yes, Chairman of the Health Committee. Sorry, Ranking Member of the Health Committee.
I'm most grateful, Mr. Chairman. Mr. Chairman, the nominee is coming from the National Health Insurance Authority, and therefore, I want to ask my first question on National Health Insurance Authority. Mr. Chairman, the nominee led the delegation for the approval of the 2023 National Health Insurance formula. May I know from him whether or not after Parliament had approved the formula, they had some extra money that we didn't factor in the formula? If they did, have that been spent? If that was spent, how did they spend it? Because I've seen some changes in the figures.
Yes.
Yeah. Thank you very much. Mr. Chairman, so for the 2023 formula or budget, the original one, and let me quickly give a small background that when the ministry is putting together the budget statement, the agencies sometimes are asked to bring their proposals as to their program of work. and the estimates they intend to work with. Sometimes, if you are lucky, what you bring to the ministry is what shows up in the budget statement. Unfortunately for us, for 2023, some of the trimming in terms of budgets affected us. So, in as much as we presented a proposal that was over 4 billion, what actually was adopted by Ministry of Finance was 2.76 billion Ghana cedis for the year. And Mr. Chairman, because the ministry has contractual obligations, the agency has contractual obligations, vendors that we've signed contracts with, claim payments that have gone up as a result of reviews in tariffs and all that. I led my finance team to make a special appeal to Ministry of Finance that honestly, if we don't get a review during the mid-year review, we're going to have serious defaults. In fact, some hospitals were not going to even get paid for claims. And I'm happy to say that with the support of the health committee, the leadership, and the hard work of the agency, Finance reviewed our allocation, and it actually moved from the 2.7 to the initial proposal we had given Ministry of Finance, which was about 4.5 billion. And so the mid-year review captured these additional funds. Mr. Chairman, so when you take, for example, claims, once we vetted the claims, we have to reimburse hospitals. And our claims budget, based on what was approved initially, was 1.6 billion. But our commitments, projections for claims was about 2.5 billion. And I'm happy to announce that because of the review that happened and the extra funds, we were able to pay our claims, and as we speak, the arrears is reduced to about 60 days. We've paid up to this month, we are paying December of 2023. This has been possible because of the allocation that was made. So for claims, for example, originally, our budget was 1.6 billion, and the actual payments we've made up to date is 2.1 billion. And the extra 400 or so million came from some of these extra funds. So I can't confirm what my ranking member on health is saying. We had some extra funds, and we've disbursed some to fill the gaps. Thank you.
Thank you, Mr. Chairman. Mr. Chairman, over the month, dialysis services has become very topical in this country. And you have been the board chair of Korle-Bu before. Since 2016, you'd agree with me that we have seen consistent decrease in the number of dialysis machines we have at Korle-Bu, from about 18 to about 13 now. If by God's grace you are approved, how will you improve upon one, access to dialysis delivery and sustainability of the provision of dialysis services without overburdening the patient?
Thank you very much. Mr. Chair, Mr. Chair, recently the situation with renal care, our handling of renal pathologies has been worrying. As someone who worked with Korle-Bu as chairperson of their board, I can say that the problems can be solved. It has to do with arrangements that are in place, that leadership must come from the ministry to sit with the managers of the teaching hospitals and go for arrangements, even be they public-private arrangements, that will ensure that the facilities are available for dialysis. So availability of the infrastructure is the first one. And there are a lot of proposals from many quarters to make such facilities available. So what we have to do is to tolerate the discussions and see which are best fit for our purpose. the cost, I was just speaking to one hospital manager, and it makes me understand that the cost of consumables per session of dialysis is 100 euros. So if you put a euro of, let's say, 16 cedis, let's say you're talking about 1,600 Ghana cedis for the consumables. That's the input into the session. So definitely, a charge might be minimum 1,600 per session, and you might need 2 or 3 sessions a week. So quickly, some of the suggestions that came up with that, some of these consumables have tax handles on them. So quickly, we must work closely with finance, government, cabinet, so that all these tax handles, we free them of the consumables. And if tax handles constitute 30% of this 100 euro, if you drop it to 70 euro, that would reflect in how much is being charged when it comes to dialysis. Again,
Doc, before you proceed, now you know the cost, not the machine, the consumables. How much do you charge? Do you know?
Mr. Chairman, so when you take Korle-Bu, for example, I think they were charging a figure, it was about 350 cedis or so before the review that brought the uproar. Now, obviously,
I'm interested in this because we use public funds to buy the machines. That is the easiest part. But the cost of running it is also from the charge you're talking about. It means that that is only about a third of the cost of providing the service. So more public cost, if it is even giving up, more public cost is added for each one individual. But when it breaks down, we don't hear you giving these explanations. We turn the argument into politics without looking at the numbers. That's where my challenge is. How does it so happen that the facilities have public, what do you call them, PR people, who are not able to explain to the public how come we are not able to sustain those huge costs for replacing them?
Mr. Speaker, so I agree with you, Mr. Chairman. When I was in Korle-Bu, I remember meeting the PR team and telling them I want them to do one release every week because I realized they were not engaging much. So it's something that we have to work on, the relationship between health facilities and the public. They don't speak much. But Mr. Speaker, Mr. Chairman, let me say that if we allow hospitals to procure the consumables for dialysis, their first instinct will be to recover the cost of the input. And that's where the charges happen. And fortunately, unfortunately for them, the argument that the problem with the Korle-Bu charge the last time was that if it's a public facility, you have to come through fees and charges in Parliament. And these processes, I'll not call them bureaucratic, sometimes leads to a gap where you are buying the consumable but waiting for approval before you can have the right recovery to buy and sustain the process. So, Mr. Chairman, what I think we can do, there are a few things we can do to let us not engage in full cost recovery. Number one, if we can have some releases or support, either from National Health Insurance Scheme, having been there, I know that we support agencies and the whole health ecosystem. If National Health Insurance has a line that supports tertiary and secondary hospitals that do dialysis, once they have some allocation, then they will not engage in full cost recovery. They will use that to complement their liquidity situation and not charge you fully. Secondly, there are some programs that I refer to as vertical programs in Ghana Health Service and other agencies. For when you take TB, for example, some of the drugs and testing equipment and all that are procured centrally by government through agencies. We know some of the consumables that are going to renal dialysis. Government can position itself that we are going to procure some of these consumables and make them available to health public facilities. All these interventions can then free managers of the system so that they don't engage in full cost recovery. I would conclude by saying that we have what it takes as a country to support kidney care. Letting people who are in that condition handle their own issue is not a good option. The burden is enormous. And so our job is to find ways to centrally uptake the burden, so that when you step in Korle-Bu as a patient, you don't feel the full force of the care, the cost of the care. That is possible. And we are going to prioritize that when we get to the ministry.
Thank you, Mr. Chairman. Mr. Chairman, your government's priority project in the health sector is Agenda 111. Agenda 111 has been estimated to cost about $1.7 billion. As of the last time the Secretariat appeared before the Parliamentary Select Committee on Health, only $251 million had been disbursed. Only 251 out of the 1.7 billion. The President in SONA 2022 assured the good people of this country that he was going to hand over all the 111 hospitals before he hands over as President in 2025. You have barely 10 months in the ministry. How are you going to make sure that we have a dedicated source of funding for Agenda 111 to be completed within the next 10 months and to be put to good use? And again, your own neighbors, La General Hospital. La General Hospital was demolished in 2020 March. And the expectation was that it was going to be rebuilt in a matter of 18 months. We are in 2024. In the 2024 budget, only 20% of the amount needed for the construction of the facility has been allocated. What it means is that about 80% of the funding is projected to go into beyond 2027. You have 10 months. How are you going to make sure that the people of La will get their hospital within the next 10 months? Thank you, Mr. Speaker.
Thank you very much. Mr. Chair, so first of all, with the Agenda 111, I'm happy to hear from my ranking member that government has committed over $251 million. It means that the Kufuor government is spending some good money on some of this infrastructure. Mr. Speaker, I am happy to also mention that I have a good, very, very good relationship with Dr. Nsiansari, who is one of the people working on Agenda 111. And we have about 50 of the facilities that have gone way up. And Mr. Chairman, when I say way up, they have, some even have had roofing done. Yeah, I mean, we have some that have had roofing done. There are a lot of them that are above, I'm not a QS person, but there are a lot that have progressed very steadily. What I want to say is that extraordinary assignments require extraordinary measures. And one of the things I know this government has been contemplating is the equipping of these facilities. Traditionally, when we build hospitals, we buy the equipment that we put in them. And I know that the managers of this project are considering the leasing of equipment instead of outright purchase. And this would put us in a position where we can succeed in having equipment put in. At least there's a minimum of about 40 that are likely to be commissioned before the end of the year. Out of the 111, there's a minimum of 40 that are likely to be commissioned. These 40 are likely to benefit from the lease program that is being discussed. And Mr. Speaker, Mr. Chairman, if we are able to operationalize 40 of these facilities, they would have filled a gap that is so significant that it will be difficult to not to recognize or to mention. And forgive me for saying this, but it is a good thing to have someone who aims at 111 and delivers 40 than the one who doesn't dream at all. Mr. Chairman, for La General Hospital, because I worked there, I have a personal experience to some of the discussions that led to the demolition of La General Hospital. In fact, when I was working in La, there were occasions when, whilst on the ward, a concrete slab would fall off from the building and hit the ground. That structure was a death trap. And I personally visited La General with Mrs. Baumia when I was during my first term, and made a case that there ought to have been some attention to the hospital. And I'm happy to say that when we met management of La General Hospital with Mrs. Samira Baumia, the management told us that their number one concern was that the facility that they were working in was not safe for their working environment. And these were the concerns that led to a structural audit, which was performed by an agency in this country. I can later get the details. And the audit stated emphatically that it was not fit for the service. And Mr. Speaker, luckily for me, I was part of the 7th Parliament that looked at the agreement that was supposed to provide the funding for the construction of the La General Hospital. Things were going as planned until, Mr. Speaker, the disruptions of the pandemic made some of these financiers reconsider their options and all that. So we all know that these agreements were signed in the 7th Parliament, but later some of them pulled out. Right Honorable Speaker, we want solutions. So straight to the solution. After all these challenges, I'm happy that we have commitment from the government to provide funding for the construction. And I'm going to work with the people of La and the neighbors. Immediately this process is completed in terms of the approval process, we are going to meet them and carry them along, explain the challenges, and give them an assurance that...
We know you have so much experience in the health sector, but cut down on... today we are not very happy. So if you are not careful, we will visit you with our grief. So slow down, yes.
So let me follow up on something that the nominee, Honorable Okoe, said. You made a statement, a very profound statement. You are being vetted to be the Minister of Health, a very serious position, a cabinet position. You just made a statement here that you are going to count on your relationship with Dr. Nsia Sari. This man, if I recall, was the Chief Director at the Ministry of Health. He's now the project, was he a Chief? Ghana Health Service. He's now the project coordinator of Agenda 111. And the minister is going to count on his relationship to, hopefully. Do you see any problem with these appointments on projects that directly should be under the Ministry of Health? You have a project unit at your ministry. You have the capacity to supervise Agenda 111. Yet, today as we speak, this Agenda 111 is situated at the Flagstaff Hub with a project coordinator. Can you honestly tell us, as minister, that these arrangements do not help your sector? And give us your view on it.
Mr. Chairman, fortunately for me, the Parliament taught me how to work with all kinds of people. So I have a very good working relationship with all those who are, I'll call them the health ecosystem. And I want to respectfully channel my energies into how to work closely with any agency, any department, any individual who also has some role to play in achieving set outcomes. Whoever has been put in place, whatever arrangement has been put in place, I'm going to apply the full force of the ministry, provide that support, and make sure that we get the outcomes realized as soon as possible. Those are where I'll channel my energies. I am content with my mandate if the House approves me, and I'll work with anyone.
Yes, Chairman.
Yeah, thank you, Chairman. Dr. Okoe, congratulations on your nomination to to be the Minister of Health. Chairman, Dr. Okoe, would you agree with me, because you've been in the Ministry of Health before, that La Hospital was brought down based upon a report after the hospital administration bitterly complained to the Ministry of Health in 2015? Would you agree with me? Are you aware? I'm coming. Chairman, I have a couple of questions. Would you agree with me?
I do, my chairman.
Are you aware that on any occasion that a company was called Cisen Consult that provided a structural integrity report in 2015?
Oh, you're right.
Chairman, I want to ask Dr. Okoe if he is aware of the recommendation by Cisen Consult, and if not, I can fully help the public as they listen to you at this point. Are you aware of the 3 recommendations?
Some of my committee, yes, I'm aware.
Chairman, respectfully, Chairman, I think it's important for the public to have been educated on this issue.
Don't worry, for this occasion, you have one more.
All right, Chairman. The rest of them will be quite straightforward. I have a lot of hope in Okoe to be a good health minister. Dr. Okoe, are you very conversant with the medium-term policy objective of the Ministry of Health?
Yes, my chairman.
Are you very conversant with the renewed program of health of the Ministry of Health 2024 to 2028?
Yes, my chairman.
And what of the budget 2024?
Chairman,
Yes, my
you're
chair.
done.
You will make a good Minister of Health. Thank you,
You're
Chairman.
done. Yes.
Honorable Dr. Okoe, it's just a follow-up question. Since you knew of structural integrity reports of LA, are you aware of any structural integrity report on Korle-Bu maternity that suggests that it's also a death trap currently?
No, sir.
Not aware of that one.
I am not aware of the report. I've not come across the report.
When was the last time you went to the maternity block at Korle-Bu?
As someone who was on the health committee, I know that the maternity block or the maternity had issues, for which reason a refurbishment plan was put in place to build a new one. So I know that it had issues, but unlike the La General report, which I was conversant with the process, this one I'm not conversant with the details, but I know there are challenges with the block. Yeah.
So the question is, when was the last time you visited the facility?
Oh, I've kept my relation with Korle-Bu, so it's not been, for the past 4 weeks I've been there, yeah.
Did you see iron rods showing and cracks in the building?
Leader, the surgical block, respectfully, and the maternity block need attention. And I think it's important to mention to the general public that is the reason why there were, and I know you are privy to that, there were agreements that government pursued to get all these facilities redone as in new ones. But similar to the funding arrangements for La General, there's been serious challenges with some of the arrangements that were being worked on. We will continue to pursue and see how we can get them to receive attention.
You know, if we had money, if the public that use that building are aware of the precarious nature of that building, they will never go to enter that building, just the way you saw La, because you were there.
Mr. Chairman, what I'll say is that I'll use the phrase, the 2 blocks need attention urgently. And I say that because even if funding for a whole new project will take some time, whatever can be done, you are a structural person, I know you know better structure, whatever can be done to at least support those structures whilst we work on permanent fixes. It must be done now. I agree with you.
Yes. Do you have a question? Leader. Okay.
Mr. Chairman, thank you for the opportunity. Let me commend my friend, the Honorable Dr. Okoe, on your nomination. Doc, you are reputed to have implemented the sunshine policy at the NHIS. Are you able to carry us along the relevance and how this policy has impacted generally on health delivery in the country?
Thank you very much. Mr. Chairman, so one of the perennial complaints about the scheme, the national insurance scheme, has been that hospitals don't get paid or reimbursed for the care that they give. And sometimes when you go to the national insurance scheme, they'll tell you, we've paid the hospitals. And when you go to the hospitals, they'll tell you, they've not paid us. And this was going on because only the National Health Insurance Authority or scheme and the facilities knew what was happening between them. No third parties, including the pharmaceutical companies that supplied them with drugs, MPs, nobody knew what was happening. So the sunshine policy was meant to throw light on payments at the authority. So what it did was that any money we pay to we pay about 4,000 health facilities regularly, at least for the 2 years that I've been part of them, almost 2 years, every 30 days. What we started to do under the policy was to upload the file of all payments on our website. So when you go to our website now, nhis.gov.gh, and you click the top left corner, you see claims payments. Mr. Chairman, if you put in the government hospital in your constituency, the name, you get to see the payments they've received in the last 6 months. The month for which they were paid, how much they were paid, and the date on which they received the money. And this has brought a lot of transparency in the chain. And I'm happy to say that now most of the stakeholders are also receiving their share of payments because people know what facilities receive. And that has been the effect or impact of the sunshine policy. I think largely we wanted to be transparent, and it is something we have to sustain.
Mr. Chairman, I know the nominee was active in the management of COVID-19 in this country and other roles you played. What are lessons that have been learned which would help us in general health delivery, particularly when it comes to pandemic management?
Well, I thank you very much. I think not everything about COVID was bad. At least COVID made us to think of investing over $1 billion into closing some gaps in health infrastructure. Only COVID could have made that case. Until COVID came, only 2 laboratories in Ghana could do genetic amplification studies, what we refer to as DNA studies. And since COVID broke, now over 30 facilities in this country have built capacity to do genetic amplification studies. Beyond that, I like to write, so I think I've worked with some of the people who were very key in this COVID fight to also put together a book on Ghana's COVID story. We were not fortunate enough to get lessons from the flu pandemic between 1918 and 1921. But at least the generation after us might get a book that tells some of the things we did and what they should also do in the future. When we are launching this book, we invite the members of the committee to be part of our story. I'm happy to say that Ghana taught the world that middle income countries also could do well at managing pandemics. And it's a story we must tell the world. Yeah.
Dr. Okoe, is it the case that if you look at the figures in terms of nurses that are trained and those that leave our shores, whether official or non-official, is a matter that should attract our attention as a nation? And if it is the case, what will you do, as it were, to keep our trained nurses on our shores?
Yeah, Mr. Chairman, I think the issue with prior to 2009, before President Kufuor became leader of this country, we didn't have a college that trained doctors to be specialists. And a lot of physicians or health personnel were leaving the country, not necessarily because of economic reasons. Some wanted to specialize and be skilled in their areas. The setting up of the Ghana College, where we could now train Ghanaians to become specialists, significantly slowed down the immigration drive. And the doctors might not be happy, not even doctors, health workers might not be happy I'm mentioning this, but one of the policies that was brought in place to make us happy then was this car waiver, the duty, where if you bring a car that is 1.8 liter or below, you can get it out without paying duties. Few things like this were able to keep most of us around, like in Ghana. I think we should be interested in the challenge and concern of health workers and be seen to be putting in place some measures for them to feel thought of or appreciated. Because the ratio is always not easy. The average ratio of a doctor to the citizen is about 1 to 9,000. For nurses, it's about 1 to 4,000. So anything you do to make them feel thought of helps. But Mr. Speaker, we also must be quite liberal with how we handle our trained staff. If you need 30,000 nurses annually and you are training 60 or 70,000, as a country, we must be interested in arrangements that would make us work with other nations, because now it's a global village. Those times when someone thought letting a doctor or a nurse work in another country will make them get forex and so become big people, those times are gone. We should see how to put in place an arrangement like the one we have with Barbados now. Mr. Chairman, when you go to Barbados now, they are so excited to have Ghanaian trained nurses with experience manning the key departments of their hospitals. It was arranged by the government of Ghana. And the statistics is showing that about 40% of all their earnings is coming back to Ghana as forex, as remittances. And there are countries that got to where they are now as first advanced countries by exporting health workers in the past. So I think it's two-pronged. We must first satisfy our needs. That I agree. We cannot ship health workers only because we are trying to give opportunities. We have to make sure we have served our needs. And secondly, we should not shy away from arrangements to feed the rest of the world. Cuba feeds us with doctors. They get earnings from this arrangement. We also can get to that place. And I don't want to be a minister of a sector where a nurse is trained, has completed rotation, and sits at home. It is even better for that nurse to have a document that allows them to be going to the hospital every day and find a way to even give them allowances, even not from the state, from that hospital, than to sit at home with skills that are not applied. The skills disappear with time, the nation loses out. So we can find a means. Everyone who is trained should apply their skills. Whether it is permanently arranged or provisionally arranged, the skills must be applied. I thank you.
If you may indulge me. Honorable Dr. Okoe, I don't know if you are conversant with this, that as a country we sign on to a WHO agreement of a sort, and that puts a certain limitation on us in terms of this export of nurses and hulibalu. If it is the case, what will you do differently to change the status quo?
Mr. Chairman, briefly, what I'll say is that these partners work with you to improve your lot or your situation. And so I'm not privy with the details of the current arrangement. But if the current arrangement limits the help that we give to our own trained staff, cadre of staff, we can always make a case as to why we want to engage in amendments. But bottom line is that the partner has to improve our lot. So we have to show that what we have now is not necessarily improving our lot, but it's giving us challenges. And I think we can explore discussions and move forward. Thank you.
Yes.
Well, once again, Honorable Dr. Okoe, congratulations. I believe you would put in your best and make us proud during the few months of your stewardship. May I ask you, in your view, you've worked as a deputy minister before, you've worked with NHIS. In your view, if somebody were to ask you, what is the #1 challenge to healthcare delivery in Ghana, what would that be?
Mr. Chairman, our biggest problem has to do with community ownership, and I'll explain. So when you go to my constituency, you have a hospital like Lekma Hospital. When a big man is in trouble, they will rush him there. When a small man is in trouble, they rush him there. Lekma might need, as a result of their budgetary constraints, 5,000 or 2,000 Ghana cedis to quickly improve service delivery. Nobody in the community feels they are part of the hospital. If you go elsewhere, I know you have had experiences abroad. The best hospitals in Europe and North America are so because there are private trusts. There are families that have committed to a particular place that I want to support this hospital in cancer research, support this hospital in doing this kind of surgery, and they have serious funding, not necessarily from the state. So if we can find a way for every community to feel that the output from a hospital, there is a role we have to play in, then there can be silent competition, where in Adakulu, you see that the quality, promptness, the morale is higher than maybe when you come to a community that is less involved. Because no matter the support from the center, if those down don't get or feel part of the process, little things will let them wait because they are waiting for approval from the region of Oneto. And I think community ownership, whether we do it through advocacy, local government structure, if we get there, our situation would improve.
Doctor, that's a very nice observation, but it is only in the health sector. All around us, you see a classroom, very dirty. Next up is a church, and they will raise money no matter how to keep it clean. Or a mosque, they will raise money no matter how to keep it clean. Individuals will pay big money. Those who complain that the school has no furniture are the same people who pay huge money to buy, what do you call them, organs or instruments. So I agree with you in many respects, but it has to do with what kind of orientation we give ourselves. And I think you call it community support. I think that generally as a country we should reorient ourselves. Yes.
Honorable Dr. Okoe, the fact is that you and I know what you just said will not happen today, will not happen tomorrow. Because the majority of the people in your constituency and my constituency are struggling to get 3 square meals. So that what you talk about trust, it is not as simple as the fact that if you go to Newham General Hospital, it is because there's a rich man in Greenwich who donated much of the money. The NHS budget in the UK, maybe 2023, is over 160 billion pounds. That is direct funding from the state. So which is larger than Ghana's economy. So it is, if you think that, yes, I agree that, like the chairman said, if you are in a community and you see the rainstorm remove one sheet of roofing sheet on your school, I'm not sure you have to wait until the Minister of Education comes to replace that one. I think the community can do something about it. But you know, healthcare is not cheap. So I was hoping that you will give me something that I can go to Adaklu and say, I can do. But even if I donate my entire 15,000 cedi salary to, my district health directorate, that will not cut in terms of solving the problem. So we need direct state funding, and we need to prioritize. So that is the first point. The second point is this. Agenda 111. Who does Dr. Nsia report to? Who you said because it's complex. The thing is many. So that is why they put him there. Let me ask you, who does he report to?
Like I said, because I've been part of the health ecosystem when it comes to this government, I know Dr. Nsiasari has a role he plays on Agenda 111. The exact details of the configuration at Agenda 111, I don't have all. But I just wanted to put a point across that I'm the kind that looks at outcomes. And I'm ready to work with all those put in place to execute an assignment without having issues with who is occupying a position that might rub shoulders with me. That usually is not my interest. But, I mean, I've been a member of parliament before. Funds being expended on this project are public funds. And so once you are expending public funds, all the contractual financial rules ought to be obeyed. All the reporting will come back to this house. If anybody does anything contrary to this, the fellow is not in a safe place. So, Mr. Chairman, for now, the exact configuration I can't give you. But I mentioned because he's someone I've come across when it comes to Agenda 111.
Honorable Dr. Okoe, you are going into a ministry which has got a well-established capital investment unit, procurement unit, man with professionals and everything. You are also aware that under Agenda 111, there is a principal consultant at JE and Partners, and then he has, though at the time he was appointed, he was not qualified to practice in this country as an architect. He got his authorization to practice after you appointed him, which is another procurement issue that can be dealt with on another day. He's then recruited Ghanaian consultants to work for him. So no, I'm not one of them. So when you say that it is so many that you needed a coordinator, who actually said that the capital investment unit doesn't have enough to actually supervise a J and Partners and their Ghanaian subcontractors to supervise the Agenda 111 decision, so that we can actually hold the Minister of Health to this house to answer questions directly? Because on a number of occasions, when we haul your predecessor to this house, he will basically tell you, I don't have much information about Agenda 111. That is why I ask you, what is the organogram of the Agenda 111 project? Who does Dr. Nsia report to? That is the basis of my question. So are you aware that, my question is, are you aware that there's nothing about Agenda 111 which is beyond the supervision of agencies under your ministry already?
Mr. Chairman, when you see an appointee that goes to question the discretion of his appointer, is not applying much wisdom. You know, all this, the architecture of this arrangement is preceding my appointment. So, and I have just about 10 months to the end of the expiry of the president's tenure. If I invest my energies into looking at the integrity of the arrangements that precede me, by the time I'm done with the structural audit of this arrangement, the term will be over. So What I would be very much interested in is the relationship with whatever structure is in place to quickly optimize and realize outcomes, whilst at the same time making sure that any commitment, if I'm part of the process, in terms of public expenditure, is in strict harmony with the financial rules, so that at any time, life is okay with me. Thank you.
Thank you, Doc. Do you know the Infectious Disease Center at, I think, Kwabenya?
Yes, I was there when they commissioned it.
Yes, and you know it was donated kindly by corporate Ghana and individuals and everybody. Are you aware that they are not under any direct funding from the state? That sometimes we expect them to do a lot, and there's no direct dedicated funding to what they do. And I will encourage you to visit them when you, I know you are very good at that, visit them and talk to them and see what you can do to help them. And I must say, when COVID happened, maybe without them, I also wouldn't have been here. So I was, Chairman, I was surprised when we were there. You couldn't even get water. Yes, there was. I'm telling you. So when I was leaving, I decided to donate a number of water dispensers and fridges, because when they were commissioned, they made a request, and then I didn't give. They just sent me the bill, and I paid. Yes. Yes. Until
ignore the aside.
Yes, until I donated the water dispensers and the tabletop fridges, there was none at the unit, and I did that as just to thank God for saving my life. So it's not anything about that. Capping of the NHIS, Doc, you've been under pressure from the public, the service providers, and when you take the budget, you see exactly how much Ghanaians have paid to the NHIS fund in the name of NHIS. Then you see the other side of the budget, which is what is actually allocated to NHIS, and many of the times, maximum half or so. Now that you are going into government, what will you do to ensure that either all that money is made available to you to support the services? In fact, you talked about dialysis and other things. I can suggest to you that if the NHS is decapped, you can actually treat almost everybody on dialysis without asking them for 1 cedi. You can do that. Will you tell this committee that you would? I know you can't dictate to the president. You will make this as yes, an appeal. Oh well, you see. Yes, Chairman, we say that we pass the law, but in this house, on both sides, there are times that one government brings a policy, the other side says, look, it is not good enough, but you use your numbers to pass it. Everybody knows the Capping Act is in your name. Yes, in your name, not in the name of Parliament generally, because you can tell. Pardon? You have. Well, so my please, will you make an appeal that the NHIS is decapped so that you can have access to your money, so we can add more things that are afflicting us?
Yeah, it's a good advice. It's the way we have to go as a country as soon as possible to free the fund from all of that. I think because we are MPs, we know that sometimes some part goes to other areas. We have to be true to ourselves. If there's a gap to be filled at other areas, we have to have other handles to fill it so that everything comes. And I must say that previous governments, current government, I've said at places, have a way of going into what comes. If we don't work at it, subsequent ones might do the same. And it is something we must work towards. Thank you.
Chairman, my last question. Chairman started by telling us a very sad story about our own colleague, my own friend, which happened today. I always say that even if you are rich, you have $10 million in your bank account. The day you might be sick, the nearest health facility might be a cheap compound. And it's just a matter of whether you can be recovered from the cheap compound to a hospital in England And many of the times, time is your enemy. Now, with what you know as a doctor, you know that diagnoses are the critical part of actually saving anybody's life. I'm particularly talking about the high-end diagnostic equipment in this country, MRI, CT, and co. The report is that majority of them, once they are provided at government hospitals, for some hands, which the same doctors who are not are able to credit card and go to a rich country and get treatment. So the one here is still the one we should make sure is working. So we'll be interested in working with you because it's one issue. And last week we met the chief executive of Whole Teaching Hospital. And we were complaining about the death rate at the hospital. And he told us something that we didn't even pay attention to. He said, why are people dying here? He said, look, it's called a teaching hospital. But the point is that when people come here with cancer, they present cancer situations and other things. The reality is that we can't do much with them here. When you refer them to Korle-Bu, they don't want to go because they don't have the money to go, because they know they go to Korle-Bu, they say go and do CT scan, go and do MRI. So it is at the heart of saving our people. So we would like to work with you if you want us to work with you. I wish you well in your endeavor.
Okay, let me give the leaders time. I'll come back to you. Yes.
Honorable Okoe, congratulations, my friend.
Thank you very much, Leader.
I was going through your CV and I look at some of your publications. There's one that I'm very interested in. It says that the mother in the monster calming the storm at the Korle-Bu Teaching Hospital. Leadership at a tough terrain. Honorable Okoe, recount your experiences at Korle-Bu. What will you say were your achievements? What will you say are things that you recommend must be done? What you see are things you couldn't do? And what are your recommendations for us to make Korle-Bu Teaching Hospital, Komfo-Anokye Teaching Hospital, Efie Contact, these very old hospitals that are at the heart of healthcare in Ghana? But unfortunately, I remember how many times I've called you and thank you for helping people who were dying for getting a bed, the no-bed syndrome. And you helped me on 2 occasions on that. I mean, recount your experiences and what is in that book, briefly.
Well, thank you very much. Mr. Chairman, Professor Fripon Boatin, after having served for, I think, about 7 years or so as a CEO at the Korle-Bu Teaching Hospital, wrote a book he named Taming the Monster. And essentially what he said was that Korle-Bu was huge. Korle-Bu was like a monster that you cannot kill. The best you can do is to tame the monster. And after spending some 22 months or so over there, virtually what I tried to say in that book is that there is a compassionate, soft part in that monster. It's really not a monster. It's a compassionate mother. But some arrangements had made it appear so. So essentially, there was one very serious structural problem Korle-Bu had, which was that because it was a teaching hospital, those who were heading the departments in Korle-Bu were actually not offspring of the management of the board. They came from the university. So their letters were signed by the vice chancellor. And the letter captures that they report to the dean of the medical school. So you can have a head of department who has not even visited the office of the CEO before. Yet the CEO is supposed to be responsible for clinical care. Now, the Act of Korle-Bu says that the board shall appoint all heads of units. So how come the board had no role since it was established about 100 years ago? It's because, interestingly, most of the board chairmen or chairpersons happen to have had a past in the teaching hospital. And this close working relationship made things difficult. So what simply we had to do, it was not an easy task, was to find a way to make the act work, which is that if you are heading, let's say, surgical department, the board and CEO should have been part of the process. In fact, they should have been the ones giving you the appointment, but with collaboration with the medical school, because there are professors who are teaching the medical school and are working in the hospital. And I was lucky to work on all trade unions, it was a sensitive issue. So every group in Korle-Bu had to be convinced, I had to convince them that until we get such an arrangement, the hospital, it was difficult to see who was in charge. They were like islands working on their own. And so finally we had this crunch meeting where I more or less told them that, look, if you are head of, so essentially the letters they get from the medical school is making you head of the faculty, not the department of, let's say, surgery. But if you want to now be head of faculty because you have a letter from the VC, and also be head of the department, we also must more or less give you a letter and conduct an interview. And it was difficult, but finally we were able to put such a thing in place. So when you go to Confanoche, you have departments that have a different head for the medical school and another head for clinical output, so that they make sure that patients get the right treatment, the time and all that. And Korle-Bu now, and that's why I'm happy to say that for some time now, the chaos, the agitation and the jostling has come down, because now the letter that all department heads have states that you report to the medical director, who himself reports also the CEO. So now the organogram is clear, and no person now acts as if they don't know who is their supervisor. And that's why after doing this, I'm happy to say that the CEO is able to go on a vacation for a year and the place is calm, because now there's order in the system. And so the monster is not a monster after all. It's a mother, a compassionate one.
So in your earlier answer to one of the questions, you had said that you hope to write a book on our COVID story. Yes, I'm sure we had a lot of heroic Ghanaians, and I'm sure you have a lot of good stories to write. But let me take you to some other very negative stories of our COVID experiences. And I'm quoting the Auditor General report as was captured by AfricanNews.com. And one of them was that the Ministry of Health paid an amount of 120 million plus to UNICEF Harvard for the supply of vaccines. However, 5 million of those doses were supplied. That 5 million was about $38 million. So, leaving a difference of about $82 million still outstanding. It says that the ministry, again, leased the building for 25 years at a cost of 15 million. The ministry also used 20 million Ghana cedi to refurbish that same building for the COVID isolation center, but that building was never even used.
Which one? Another group.
Well, he knows it. Honorable nominee, these and other many negative, heartbreaking stories about monies that belong to the ordinary Ghanaian taxpayer were part of the story you have to write about the COVID era. Exactly what will you do as a Minister of Health when you get a nod to recover the people of Ghana's $82 million plus all the other monies I've talked about?
Mr. Chairman, so let me quickly say that I don't believe that we paid 120 when we knew that we will receive 38 million. Truth is that in vaccine purchase, you have to commit early so that others don't usurp or cross you in the queue. In fact, UK, US, one of the reasons why they had first supply of vaccines is that they committed themselves even when the vaccines had not been fully developed. So I'll just say that for purchase purposes, sometimes you have to commit. But if the records show that the value you've had is 38 million and there's a shortfall of 82, steps must be taken to recoup, either fiscal cash or, like I said, we still have ongoing vaccination programs. Luckily, the same, most of these agencies like UNICEF, Gavi, they are the same people that manage other traditional vaccines. So, honorable member, I would commit strongly to making sure that we get the value of all our money. either you retrieve in cash or you get other services that will make up.
You are not new to the ministry. You are in the sector.
Yeah.
Are you aware of any steps that have already been taken?
I don't have those details for now. I don't have those details. And the part about the isolation center, I think fortunately or unfortunately, by the time some of the funds to complete these isolation and treatment centers arrived and we finished building them, you had a situation where there had been some form of improvement in our COVID situation. So when the disease struck, rather, when you needed funds urgently to do it, we had some existing hospitals like Korle-Bu, Konfanoche, University of Ghana. We had to dedicate some portions of their facilities for isolation and treatment. But by the time we built our own, from the funds we allocated, the wave had died down, and some of these facilities look like white elephants. But I'm not praying that we experience another health crisis. But should you get any crisis, their relevance will show up quickly. They are not money wasted. Yeah. Thank you.
Robert Nominee, let me take you to some of the diseases that were. This morning I woke up to a very bad news, and it happens almost every other time. And when it happens, our first instinct is that, oh, somebody has killed him. And it has to do with non-communicable diseases. The World Health Organization says that NCDs like heart disease, stroke, diabetes, and chronic respiratory disease are responsible for 73% of deaths in Ghana. Considering your very short period of time, I've seen you've even written a book, High Blood Pressure in Black People. These are really the core of the diseases that are killing us, and often we attribute them to all sorts of superstition. Because this person I'm talking about woke up this morning, he was fine, he walked to the beach, then he collapsed. So if he's in the litigation with anybody, or somebody has done something, exactly what can you do with these 8 months to try to address this big problem of non-communicable diseases that I've described?
Mr. Chairman, we've done a lot of education. People know their condition. Some even know their blood pressure reading. They will not take their medicine because for the men, they will say that they cannot perform. For the women, they will get cancer after some years. Mr. Chairman, I always use the example of seat belt. If you have a car now, whether you feel comfortable with wearing a belt or not, the law says you have to wear it, because research has shown that it saves lives. So your judgment or opinion is not important anymore. The same must be applied by this country. I'll not say in the future, but more or less now. A lot of adults in Ghana now don't know their blood pressure reading. They don't know their sugar. Even if they know, they also not take care. I'm happy that the National Health Insurance Scheme is now contemplating or going into the area of preventive care, where we want to make sure the adults in this country at least are screened for their pressure and sugar. But I'm happy we are dealing with Parliament now. Parliament must get to the place where it connects the blood pressure and sugar reading of adults to one particular national activity. For example, before you get your license renewed or you get your SNIT, you get one particular exercise which you do annually, the state must demand the reading of your blood pressure and sugar from a recognized public hospital or a reputable source. Because if your blood pressure is malignant, which means you can drop dead anytime, it is our duty to do whatever we can to persuade you strongly to behave. But as we speak now, there are people walking around, they are working with malignant pressure, they can drop dead anytime, they have no symptom, they have no idea. The worst is that majority even know they have pressure, but because of they talk in town that they might not be able to perform, they are not taking their medicines.
Just a follow-up. Doc, if somebody's got blood pressure because he can't pay his rent, or poverty, he's got blood pressure because he can't pay his children's school fees, he can't pay his rent, what prescription can a doctor give to that person? He should go and exercise and reduce his pressure.
Your blood pressure medicine will save you from stroke. In fact, the number one cause of kidney disease in Ghana is blood pressure which is not treated. But poverty and hunger will not bring you stroke. In fact, by the grace of God, you might recover from that state in the shortest possible time. But the pressure will take you away before your recovery even comes. So we have a duty to find a way. In fact, I'm happy that I met someone who wanted to buy food in Canada, and the restaurant operator told him that after inputting his details, his last LDL cholesterol was high. Does he mind that they suggest other sources, healthy foods for him? It's been made available to restaurants. They are not secret. A few of them, because of your own purpose, can be made available to the state agencies. So we have to find ways to work on this screening.
So you tell those who are suffering that you can't eat kenke, you have to eat salad.
Luckily, kenke doesn't cause some of these problems.
Which one? What gives you the problem?
It's a public vetting, so.
Okay. 2021 study by the University of Ghana talks about very high prevalence of mental health disorders in Ghana. Now, the stigma around mental health and the fact that there's no medical access in terms of treatment combines to create a huge problem. So mental health treatment in Ghana and the stigma will not even allow us. Somebody just described that we are all mad small. It depends on how the level of your madness. So, Doc, exactly what steps are you going to take to try to make sure, number one, you help educate people on mental health, and then ensure there's mental health access to healthcare?
Thank you very much. I think one good thing that the Ministry of Health, and for that matter, Ghana Health Service, has worked at in conjunction with the Mental Health Authority is to make sure that in every hospital or district hospital, there's a mental health nurse. So largely, mental health care has been decentralized. So when I was in Chebi, for example, we had a mental health nurse in a small wing, so that when I get a patient who has mental health issues, after assessing the physical illness aspect, we refer them to the mental health nurse. But a few difficult cases had to go to the centralized places like Ankaful, the Accra. They have specialists to handle the more difficult cases. I'm happy to mention, and I'm not the one announcing, but the president announced a few months ago at the Korle-Bu Teaching Hospital that the National Health Insurance has been tasked to consider onboarding mental health on its benefits package. Mr. Chairman, we've worked on all the technical details to make sure that beginning second quarter, the top 4 mental health conditions, including schizophrenia, bipolar, and depression, are covered on our National Health Insurance scheme. So what it means is that.
Great idea, but let me, I didn't want you to talk about the National Health Insurance. You know the state of your National Health Insurance and how many hospitals are to the current state even accepting. Oh no, I'm allowing him, I'm adding it so he can. So the real challenge is not the addiction. Exactly as you address the question, exactly what can we do to basically make sure that even as we add more of these to the National Health Insurance, it is something that is accessible.
Yeah. One more. Doc, when we spoke to the facilities handling mental health cases, the projection was that should we support them with about 20 million Ghana cedis annually, it could reduce the cost burden that patients face when they go to the facilities. So I know that sometimes people say, be careful to add more benefits to the package. But the truth is that we are in a good place to pay 20 million annually. So some of these things also, paying them brings relief to some of the patients. Unfortunately, and when this committee is gracious enough to approve me, some of the challenges we have is not because insurance is not giving money to facility. Sometimes monitoring is not strict. So there will be a lot of case to onboard the benefits package. You start giving this 20 million annually, and excuses will be given to still take money from the clients. But if we have strong monitoring systems, honorable, there will be people who will tell you, I used to pay, let's say, 100 Ghana cedis a visit. Now I'm paying 10 cedis. It is significant relief to the ordinary Ghanaian. And that's the point I want to make. Secondly, we need a lot of orientation. Honorable, in this country, even learned people, when they fall sick, if a good friend or Samaritan doesn't help them, relatives convince them that someone is attacking them spiritually. And I have seen people, I had to physically go and pick one of my aides and take him to the hospital because the wife was preparing for them to take him to his village, that someone was doing something to him. Within 5 days, he was discharged from Lekma Hospital. And this man is a very noble man, middle class, does oil business. So we need to have an orientation that mental health is not spiritual, and that when you get it, you should seek help, and that it's possible for you to be taken care of. We'll work on that orientation. Thank you.
My last one.
What is the main?
My last one. Oh, you're going to.
What is the main reason why people keep having that level of mental problem in this country? We need to know, because for all you know, it's something we all do without knowing the consequence.
I think I'll wait for some empirical studies, and then I'll share the results.
The doctors are not able to discover what it is.
He's not a mental health expert, so he won't risk it.
But let me ask, you can say yes or no. Is weed smoking part of it in young people?
Weed is centrally acting. It works on the brain. If it distorts the chemicals in your brain, you can go off. So it's one of the causes.
Look, my last question. If you get a stroke today in Ghana, we are 68 years, you spend 1 month in the hospital, and you are discharged, where do you go? Your house. You have to go home. And that is a big problem. I have visited places and I see rehabilitation hospitals, centers where we have physiotherapists. I've wondered why we don't even have one. Exactly what will you do to make sure we can have rehabilitation centers for people who go through all of this? Because one of the things that I've realized is that it's one of the recurring problems for people who need rehabilitation.
Honorable, we, as a country, we have to work towards that. So these are things that would engage my mind as I go to the ministry. Thank you.
I wish you all the best.
Yes.
Thank you very much, Mr. Chairman. Honorable Okoe, congratulations. I don't think I want to bother you with too many questions, but I'd like to acknowledge the fact that you are one of the rare people, you are one of the people who have had the rare opportunity to be the chair of Korle-Bu Teaching Hospital and also to run our National Health Insurance Authority. And by the answers given over here, I realize that you have a wealth of knowledge in the health sector. If given the nod, I want you to give us 2 priority areas where you think we can concentrate to improve on our healthcare delivery as a country. Thank you.
Thank you very much. So the face of our healthcare delivery is the emergency setup. I think the emergency setup of hospitals, public facilities, private, we need to do some serious restructuring, reorientation, and all that, so that the experience that the ordinary citizen gets when they interface with this place, because they are the first point of call, so that we have a better experience. So it's going to engage my mind seriously, emergency, including ambulance service delivery. And then secondly, I think the second one is what Honorable Boye talked about. In the past, stroke and kidney care were not part of our burden. We were more interested in malaria and other diseases. Now, we are getting a lot of this. So, rehabilitative care, we have to find ways to put infrastructure or to find a means to support people with those challenges. That's palliative or rehabilitative care. So these are the two areas that we have some work to do. The others will also get attention. I thank you.
Do I get the assurance from that you are going to pursue this line of action to improve on our healthcare?
Yes, Honorable. We'll work hard at that.
Accountable to that. Honorable Okoe, you have had let me go on this way. We have some child activists who have been pushing for a ban on displaying sick children to solicit medical support. I don't know what you think about this. Do you share the idea or this view that it should be banned? And if so, how would you go about tackling that? Because some of them simply don't have the resources to take care of their kids. I don't know. This is an activist, a child activist, who feels it's so wrong to display kids on television soliciting for some kind of medical financial support. Thank you.
I know some people solicit for funds because they genuinely want to help the kids. Some also use the kids to make money. Now, if you ban and you don't provide a means for the genuine ones, then you cause a problem. So we can sort of have trust or have some publicly supported entity whose job is to take information across the regions on kids with pathologies or illness that require support. And instead of allowing those who parade them to ask for the money, this publicly supported entity recognized with the right structures should be the one to direct the funds to. So as we speak, we don't have the structure in place. So from the ministry, I'll work with the team to see how we put this structure in place. If it's a hotline, if you have a child who needs support, call this line so that it comes to the center. And I think I might have credibility asking for funds for the child than the one parading the child. So it will engage our mind how to support kids with conditions which are beyond their parents. We must provide an avenue so that the quack people don't exploit it.
Thank you very much, Honorable Mr. Chairman. I'm done. Congratulations.
Thank you very much.
Ranking.
Mr. Dr. Bernard Okoe. Good evening.
Good evening, Leader.
I note from your CV that you served as a Deputy Minister of Health between 2020 and 2021. And you also served as a member, National COVID-19 Task Force, 2020-2022. Have you had the privilege to look at the audit report, special audit report on COVID-19?
No.
Please, take your time. Have you had a look at the audit report?
I think I've had a fair look at it. Yeah.
Okay, I'll ask you some few questions on the audit report. First, I will revisit the question that was posed by the ranking member on the 120 million UNICEF AVAT COVID-19 vaccines. According to the Auditor General, 81.8 million US dollars remain an amount in arrears yet to be supplied. What is your knowledge about this transaction?
I was assisting my minister. I was not the one working on the details of the procurement and all that. All I would say is that if you have public documents that have made references to facts, I would work hard to make sure that nobody swindles us. Basically, work to retrieve our money if there's a case. Yeah.
So,
are you saying you were the mate?
Stop. Colleagues, 1 second. During your time as a member of the task force, are you saying the task force did not play any role in the acquisition of these vaccines?
Yeah, so leader, usually what a task force did, the task force did not play technical or agency ministry specific detailed work. So the task force usually would look at the broad policy areas. So for example, the task force would say that we should go in for vaccines. Yes. The task force would say that we should prioritize, let's say, the aged first and then deal with those with comorbidities. So the task force concerned itself with the broad policy. But in terms of details, when there are procedures to be followed, commitments to be made, legal lines to be crossed, all were left to the agency-specific or ministry to execute those ones.
Okay. So the same Auditor General's report. Apparently, medical equipment valued at $247,000 US dollars were procured and received at the central medical stores and subsequently issued to specific health facilities, but this equipment did not reach the said facilities. Bernard Okoe, you served at the time as a deputy minister. What do you make of how these COVID-19 funds were handled?
Leader, forgive me for saying this, but more than half of this country, the population, have been vaccinated against COVID-19. And all the vaccines we received were through some of the funds allocated for COVID management. All the health personnel we used, there was an operational cost to deploying vaccines and all that, all came from the funds. I'm just saying this to say that respectfully. If you look at the funds that were in for COVID, a lot of good was done in this country from the funds. Those occasions where the auditor has shown that we were not above board or could have done better, my position is that there are lessons for us. For those that we can retrieve, we'll work at retrieval. But forgive me, it is because I was at the ministry, I know that a lot of good that happened from this country came from the same funds. And as human beings, sometimes those ones don't get much attention. So it's weird, but that an equipment was bought and did not get to the destination. When I go there, I'll get to know exactly what the situation is and try to resolve some of these matters, if they are resolvable as we speak.
Can I take that as an assurance?
Yes, leader.
The same Auditor General has reported that medical equipment, again, valued at $110 million, and the pages are there, I'll refer you to the pages, 110,000 US dollars and 27,895 Ghana cedis were issued to a private hospital in Medina, though it did not serve as a COVID-19 isolation. Honorable nominee, I've heard you and all what you have said. Can I hold you accountable, going back to the ministry to bring closure to some of these concerns the Auditor General has raised?
Leader, if you approve me for now, then I'll give you the assurance. But Leader, I want to say that I have the document here with me, some of the salient points. I'm going to treat it very seriously so that we can do recoveries for those that we have. Yeah.
Thank you. Now, in February 2023, Ghana was hit with a shortage of routine child immunization vaccines. Again, in about October 2023, the renal dialysis unit of Korle-Bu Teaching Hospital was also closed down due to 4 million Ghana cedis debt. Within 4 months after the closure, 19 patients died. Last month, to my surprise, Komfanoche Teaching Hospital turned away kidney patient seeking treatment due to insufficient machines. Would you admit that Ghana's health sector is in crisis? And if so, what will you do differently to revamp it?
What I'll say is that the various arms of care in the hospitals, the arms of care are many. And I know there are many areas that are doing very well. And in fact, that's the reason why we are not hearing of them. Those areas that have challenges like renal care need attention. And I assure the committee that one of the prioritized areas, immediately I go to the ministry, would be renal care. The good thing is that the challenges they have are surmountable. They are not beyond us. I don't want to go into details and create the impression that it is those who manage the facilities that are, in quotes, clueless. But I'm going to work closely with them so that the story is not the same. The 4 million that was mentioned for Korle-Bu, let me quickly say that it is the under-recovery that came to 4 million in terms of how they were running. But their real challenge had to do with sustainability. As in, if they get even consumables today, they will start running into deficits again. So our challenge will be to work at a sustainable arrangement that makes them operable at no deficits.
Why not? Is the health sector in crisis? You have not answered the question.
The sector has challenges. Maybe we can qualify with significant challenges in particular areas.
So what will you do differently?
So,
if you are lucky enough to be approved to fix some of this crisis?
I'll be like you. I'll be a hands-on leader. I'll go to them, sit with them regularly until there is comfort, assurance, and sustainability in terms of their delivery and performance. I'll prioritize that area. I'll be on the ground.
Now let me take you back to where you have just resigned as the CEO. The National Health Insurance Scheme. I read a report online that the National Health Insurance Scheme is indebted to service providers in excess of 8 month outstanding arrests. Again, I also read that National Health Insurance no longer provide coverage for certain diseases, that previously used to cover. As the immediate past CEO of the scheme, what will you say to be the current state of the National Health Insurance Scheme? Are we also in crisis? And if not, why? Why are we seeing all what we are hearing?
Leader, in the past, I will not say you used to, but you could hear hospital managers and owners threatening to turn away patients because they were not paid and all that. For the past 1+ years, you don't hear them talk. Every 30 days, we pay an average of 160 million Ghana cedis every 30 days for the past 12 months. And the leadership of the private hospital owners came to tell me that now their challenge is that some private health insurance companies were not performing like NHIS, so they want to take them on and not ask anymore. So we have been very aggressive with payments because it was an excuse hospitals gave for taking money from the ordinary Ghanaian. And leader, forgive me, but unfortunately sometimes some people play politics with some of these organizations, including NHIS. It's unfortunate. I was just there when someone forwarded that news to me, and I knew it was mischief from someone. So quickly, I told my corporate affairs to put issue a release, and the release even gave details of the files, the payments we've made online for anybody to check. So please, the news was mischief. As we speak, we've paid up to. We are paying December of 2023 this month. And technically, the best hospital, the most efficiently managed hospital in Ghana, would have submitted only December claims to us by now, even the best. It takes some time for them to bring January, February to us. We just entered March. So if we have paid to December, it means that almost every claim that has come to us has been cleared. So leader, my prayer is that with time, we can achieve consensus on some of these our agencies that are sensitive, so that someone does not paste such a story to create the impression that we are in crisis. Yes.
So in short, the story is not true. No, are you confirming that the story is not true?
No, the story is not true, leader. Yes.
You have been a board member of the National Health Insurance Authority since 2021 and CEO since 2022. What has been your legacy?
Leader, when I went to the authority as board member, the arrears span was about it was moving between 5 and 7 months. Usually, because NHIS works on a credit basis, you normally take away 2 months and don't count them as part of the debts that you have. So for example, we are in March now. So January, February is not counted. So if you've paid someone up to December, what it means is that you are right up to, you are on time. And I had counsel from an elderly person on the board, that doc, if you become CEO, make sure that it will be said of you that when you were leaving, these 5 months, 6 months arrears became a thing of the past. And I'm happy to say that when you talk to hospital owners today, including private and public, they will tell you, in my time, they get releases sometimes twice in a month. So that has been a wonderful story. And I have to credit the Ministry of Finance. I had a close relationship when I was in Parliament with Honorable Abina. He helped a lot. So they worked closely with us and gave us our releases. The Sunshine Policy, leader, is also a very wonderful policy. So on your phone now, you can get to know what the hospitals in your district are getting. So that if they create the impression nothing is coming, you can question them on what they are using the monies for before you can come in to support. And I remember I attended a conference of doctors. When I gave all these details, some jokingly said, "Doctor, take your time. You are going too much into details." This policy makes our work known to the public, and it's a good legacy.
Dr. Boye, I know you are a medical doctor. What is your take on this anti-LGBTQ bill?
Mr. Chairman. Mr. Chairman. Yeah, leader. So, myself, I was raised in the Baptist church. I'm a follower of Christ. And my personal teachings I don't subscribe, or I'm not someone who would be an advocate for same-sex marriage. Now, I'll put it bluntly. If I have a friend or know someone who is in that sphere, I would engage strength and energy to convince them to come to where I believe in. But as a doctor, I can also tell you that my work tells me I should not put such people away or make them feel less human. So I am a professional, but I still hold on to my faith. That is what I have to say.
So let me ask you, should the president sign the bill or not?
If he seeks his advice, he tell the president.
Mr. Chairman, over
if
to
you
you.
want to answer that question, but it's not a question I oblige you to answer.
Mr. Chairman, I take your counsel.
Mr. Chairman, let me rephrase this question. Mr. Chairman, you've been nominated as a minister for health. Likely you'll be a cabinet minister, obviously, for health, or you are replacing a cabinet minister responsible for health. The matter before us has health implications and other implications. If the president calls on you as a minister responsible for health and seeks your advice whether he should sign or not to sign, granted that we have approved you, what will you say to the president?
Because you are talking about health, there is one political leader or influential person in this country who was asked about sexually transmitted diseases in LGBT people. And the leader said that because it is a stigmatized group, they go under the radar, and although HIV and other diseases were being managed well, in that particular group, it was rather spready. Those people go under the radar if the temperature in the country, they feel that they are a marginalized group or they are being ostracized. And this political leader virtually said that it is a problem that has been looked at. As a doctor, what I'm trying to say is that any policy you go in for a doctor, I'll give you advice on the repercussions. Now, with all the debate that has gone on, anybody who is into that practice, with all the challenges they have with disease and all that, they might not openly come to me for help. So, as a country, I'm happy there are MPs here. Let's debate more. Let's see how to. Oh, but you mentioned that the advice from the president. An advice normally will come with commentary on the pros and cons. So I would only lay bare all these pros and cons, and based on the judgment of the president, he will take guidance.
So, last but one. I have two more, then I'll be done. You are a native of Teshi. What do you make of your government's failure to reconstruct the La General Hospital? This is extremely important. No, but so I need to.
But, leader.
And remember, it's 7 years on.
Yeah, leader.
I am happy. You have already answered this question. Yes. It's on record. Yes. He was not in the seat. So give him a brief outline. You don't need to give all the details.
I know they are building it. But the question is 7 years after demolition. And that is what I'm asking for.
Leader, respectfully, I'm fortunate that I was part of the 7th Parliament. Leader, we passed an agreement in Parliament which was to fund this project. I was in Parliament, the funding for La General. Leader, we all know it had significant problems subsequent to the pandemic breaking out. So I just want to say that, leader, sometimes, I will not say unfortunately, because of, and it's part of our life, because of the competition amongst governments and those who want to come to government, we can decide to not mention some few significant disruptions. But COVID, this arrangement could have materialized. La General could have been up if some of those things had not happened. But that's what we have now. And I'm happy that we have committed to building and completing it. Thank you.
Finally, Mr. Chairman, I note from the CV, Mr. Chairman, I note from the CV of the nominee that Mr. Chairman, I note from the nominee's CV that oftentimes they bring him as a substitute. In the year 2000, he was brought in as a substitute. 2020, he was brought in as a substitute, reshuffled to be a deputy minister, same ministry. This year, with 9 months to go, they are bringing him in again as a substitute. Why do you have a history of being a substitute? And always coming in at times that I call it garbage time.
Leader, when you're a footballer, you are trained to play. Anytime they give you the opportunity, you have to get on the pitch. So I'm here to play. I pray the impact is felt. Thank you.
Chairman, just wanted to remind him that in football, sometimes in basketball, there's something we call garbage time. They bring you in just to warm you up, but knowing very well that you're only a bench warmer, just you can't score a goal, but you are just part of it. So I can only wish you well.
I know that good strikers coming in the last minute, and sometimes they call hat tricks. Very well. Honorable Okoe, today we read tribute for two former members of parliament. Sad. And just before the ink would dry on the paper, we had the news of the demise of a certain member of parliament. But in the course of the discussion, one thing came up, that the health of former members of parliament, and the facilities available to them across the country is a challenge. Would you suggest how the Ghana Health Service or any of the teaching hospitals can be used to support? If they were soldiers, they would be entitled to retire on their conditions of service. If they were in the legal service, they will retire on their conditions of service. If they were in the police service, they will retire on their conditions of service. If they were in the judiciary, they will retire on their conditions of service. It's often only politicians who nobody cares about. But when they leave parliament and public service, they often have no support, no backup, and often unemployable. Would you suggest how we can use the Ghana Health Service or the teaching hospitals to support such persons?
Mr. Chairman, having been in Parliament before and being privy to the work of a member of Parliament, I can say that the job itself is a risk factor for ill health and, in worst case, death, because of the kind of pressures that you have to handle. And Mr. Chairman, unfortunately, because of our training and culture, we don't go to the hospital or go for checkups until we are very ill. So I recommend two things for our legislators. If it is possible, we should have a medical break, a week, a medical week, a break in every sitting. I hope I get a term right, when you come back. It is only when members know that this week has been called off specifically only for medical checks that they will go for the check. And to make sure they go for it, leadership of Parliament must be interested in the reports that came from their check. And Mr. Speaker, it's not the leadership that will go through, it's the health unit, Dr. Pambo and his colleagues, so that all the red flags, we can categorize the MPs into yellow, green, and red. Red means that if leadership doesn't engage the person, they are a high-risk case for us. So that is the first one that I recommend. A break specifically for medical review, a week, so that there's no excuse that I don't have time. And then, Mr. Chairman, the other one is that the main item that drives a lot of former MPs under or into the poverty line or makes them struggle has to do with healthcare costs. What we can do quickly, and it is possible. Luckily, you have a very important, I'll not say power, but influence as legislators. We should put an arrangement such that once you've passed through Ghana's parliament and you are alive, in every region, there should be 2 facilities that you can attend with your card. A special card must be given to you. Any intervention you need that can be done by that facility must be given to you without asking for money. And the bills sent to Ghana's parliament. You must enjoy this till you die. And it is possible to identify 2 health facilities per region. One should be a primary facility. The other should be a secondary or tertiary facility. And then top it up with Konfanoche or Korle-Bu, that assuming the one in your region cannot handle you, when you show up in Korle-Bu or Konfanoche, whatever intervention that is possible there in Ghana, you should have it without asking for money. Bills should be sent to Parliament. Mr. Speaker, Mr. Chair, you can handle this. And because the numbers of MPs who pass through the House will not overwhelm the resources of Parliament and the state, this can be done, except to say that we must have checks to make sure people don't abuse it. People don't give the card to a friend or someone. But this is possible. And who else can do it than you who pass laws and approve arrangements? So these 2 I recommend for the House. I thank you.
Thank you very much. This is a suggestion to the House. Well, in your CV, you have 2 publications which interest me. In fact, in one of them, you actually brought me a copy of the publication. But shamefully, I haven't read it. The high blood pressure in black people, an explanation of what high blood pressure, hypertension is, how to prevent it, and preserve it. I was at the launch of the book. You subsequently gave me a copy. And in short, what were you trying to say?
Mr. Chairman, every 10 deaths that happen in adults in Ghana, about 7 are connected to either high blood pressure or diabetes. So I wanted to address some of the challenges I saw in the consulting room. When the Ghanaian is told he or she has high blood pressure, they don't understand why they've been living their life, they don't have any symptoms, and all of a sudden, you are telling them take medication. So the biggest problem is appreciating how this high blood pressure came about. So the book tried to explain what your pressure is, first of all, from birth, and how come as you grow, sometimes it goes high. And then secondly, to explain what the medicines that are prescribed by doctors do. Because people don't understand why they don't have any symptom. And you are telling them, go on this medicine for the rest of your life. And then thirdly, directly, I wanted to confront some of the excuses Ghanaians give for not taking their medications, Mr. Speaker. And Mr. Speaker, I know one man who owns a drugstore, was selling BP medications, but wouldn't take his medication. And the wife told him that if he doesn't take it, he might die. And the man said he would prefer to die with his performance intact than to take medicines and get a compromise of his performance. and Mr. Chairman, I was in my residence, the medical officer's residence, when I was called one dawn that he had been rushed to the hospital. This man I'm speaking about died from hypertensive crisis. He refused to take the medicine. The wife warned him. He said he would prefer to die, and he actually died. So the book, and Mr. Speaker, what I realized was that if you get time to sit with a patient for more than an hour and explain all these things, then they get change of mind and go on their medications. And I'm happy to say that the women do far better taking their medications than the men. And Mr. Chairman, I always tell my clients or patients that I know women who have been on BP medications for 50 years because they are very meticulous. But the men are very bold, in inverted commas, and wouldn't take their medication. So this is a book that once anybody who can read and write reads, they get a change of mind.
Very well. That's a very good exercise. Probably you should be spending more time discussing that book. One third of the time you spend on metro, use it to discuss that book only. That the other parts will get that benefit also. The last one is just, it's also the publication you call the Audacity of Ambition. Have you read President Obama's book called The Audacity of Hope? Have you read that book?
Yes, Mr. Chairman. So this title was actually influenced after reading that. And so basically what I tried to say in the book was to explain why I was very ambitious and I will not say aggressive, but was daring to go into areas. None of my relatives was into politics. I don't have any political or politician in my family, even 2 generations back. And sometimes people want to understand why I get into some of these things. And I try to inspire young people to take themselves on and push themselves, and that would make them better off and their nations and communities also better off.
Very well. Today, today we are sad, but somehow you've managed to keep us active. It's been a very useful exercise this evening. We thank you for attending upon the House to answer questions. We will discharge you, but you will hear from us again. You brought me a list of people I should recognize. Mr. Humphrey Boye Mate Sanshi. Yes, is a father. Is your father. Nene Tete Waka the third is the paramount chief. Nene, you're welcome. Madame Louisa Atajiman, Deputy CEO NHIA. You're welcome, Louisa. Dr. Da Costa Boye, Acting CEO of NHIA. You're welcome. Dr. Divine Otu Agrohom, Regional Chairman, MPP. You're welcome. Alhaji Hafiz Adam, Chief Director, Ministry of Health. You're welcome. Honorable Mordecai Kwashi, MC of Mordecai, you're welcome. Madam Joyce Konoki Zempare. Oh, okay, Zempare, okay, yes, you're welcome. The board member of NHIS. That's all. There are a number of my former colleagues here. Yes. I've seen Honorable Husseini, Honorable Ebenezer Nate. I saw another one. Honorable Aboji Jedu, yes.
To see him small.
They say they have missed you. They want to see you up for that. Thank you. Thank you all for coming to support the nominee. We are discharged now.
Thank you very much, Mr. Chair, and thank you to all the members of the committee.
Kindly bring in Honorable Titus-Glover so we finish with him quickly. Can you clear the entrance so we can take the next one, please? Dr. Koboy, remember, we have not cleared you. If you delay us, it will all go into your consideration. Kindly administer the oath to the nominee.
I, Okunye Nabi Nyokobi Daniel, ni Kwate Titus-Glover.
Swear by the Almighty God.
Swear by the Almighty God.
That the evidence I shall give before this committee.
That the evidence I shall give before this committee.
Touching the matter in issue.
Touching the matter in issue.
Shall be the truth.
Shall be the truth.
The whole truth.
The whole truth.
And nothing but the truth.
And nothing but the truth.
So help me God.
So help me God.
Honorable Nominee Titus-Glover. On behalf of the committee, I congratulate you on your nomination as a regional minister. You are a former member of this House, two-term member of this House. You have appeared before this committee once. We asked was then constituted as a Deputy Minister for Transport. In fact, you were a member of this committee. So you're quite well known to us. But you are no longer a member of Parliament, so you are not entitled to the courtesies we extend to our colleagues. If there's any changes to your CV as we knew it, kindly tell us.
Thank you so much, Mr. Chairman. Nominee Titus-Glover is my name. I was born 57 years ago. My father was Benjamin Titus-Glover from Asina Joshi, Otublohun and Osu. And my mother is Mrs. Agnes Nanyoko Titus-Glover from Bese, Atupai, and Tema. I started my early childhood development 6-7 months after my birth at Municipal Daycare Center in Site 10 because my both parents were career workers. For 4 years, I moved to Dex Preparatory School. In fact, we started Dex Preparatory School at the veranda in Site 13 for about a year. And then at age 6, I moved to Chudase Primary School in September 1972. My primary school, my middle school were all in Chudase Primary and Chudase Middle School. I left Chudase Middle School in 1982 to do my secondary education in Presec Legon. I did my sixth form national service privately at Accra Academy. Thereafter, I did my national service in 1989.
Mismanagement of public spaces by the MMDAs.
Mr. Chairman, the role of the regional minister essentially is to coordinate, is to monitor and evaluate the works of all MMDAs in the region. And the tax is on every assembly or government agency to do what is necessary. My duty is to ensure that all these arrangements are religiously pursued to ensure that this kind of indiscipline that we see in the region are kept up.
Coordinating, facilitating,
monitoring,
they are to achieve something. For me, I live in Adenta municipality. Whatever happens in a person who probably is...
Let me say, certain developments and progress. After government have seized intention of the usage of such lands, instead of the constitutional mandate of reverting the lands to the alludia owners, we end up these lands being sold to private entities and used for development purposes without recourse to the original owners of the land. Some entities have also decided to extend their mandate beyond the boundaries of their jurisdiction. For example, let me give you an example. Just last week, there was a problem between TDC, and the people of Manya Jopanya in the Shaidoku district. As regional minister, and knowing you as somebody very, very interested in the issues of Gandangwe, what will you do in order to wipe off the tears on the faces of our chiefs and people?
Grateful, Mr. Chairman. Two quick questions. One is about the refusal of government to give back our lands to us when the purpose for which it was acquired has not been fully utilized. What should we do? And the second one is about TDC Development Company Limited and Jopara traditional area. My response to this is simple. Mr. Chairman, it is captured in the Constitution, like you did say, that at any time when government acquired a land and for purpose for which it was no use, the first choice is to get back to the allodial owners of the land. As we speak now, I don't know any such lands that is before us, except where my attention is drawn to it, an application is made before me, then we can put in a word to His Excellency the President and see what can be done about it. But for now, I'll be gracious enough if you can give me one or two examples so that we'll know what we can do about that. The issue about the TDC and Jopanya, currently as we speak, the term acquisition is gone. There's no land anymore. So TDC is now a limited liability company where they move out of the acquisition area to own lands. So the arrangement that went between TDC and the Jopanya, Manya Jopanya, I cannot tell. But if you have any further information that you can assist me with, maybe any application is made before me, God willing, when I had your support and approval at the plenary, we can all look at it and see what resolution we can put to the matter. Thank you very much.
Now let me take you to another issue of our language and culture. Over the past months, people like lawyer Okoe Otu and the Gandangbe movement have lamented over the issue of the teaching of the Ga and then the Dangbe languages in our schools, with a flimsy excuse of we don't have Gandangbe teachers. Language is our identity. And when we lose our identity, we lose the people we are. As a Gandangbe coming to this seat, what will you do to ensure that the Ghana Education Service policy of teaching children between class 1 and class 5 in their mother language is adhered to? And also to ask, why should Neil and Tivana be schooled in Sunyani and forced to learn Akan? And then Rekubrobe's son is schooling in Accra and will not be forced to learn Ga, but will have the liberty to learn Twi. Whilst Neil and Tivanapo's son will not have the liberty to learn Ga in Sunyani. Is it fair? And what will you do about it?
Thank you very much, Mr. Chairman. It's unfortunate that urbanization has contributed immensely to this challenge that we are facing as a region. And we are proud as Gadangwis that we are identified first by our culture, our tradition, our food we eat, our festivals, and the language or our dialect that we speak. Whatever I would do with your support and recommendation of this committee and other plenary, I will quickly liaise with the Minister for Education. I recall during the vetting of my brother, similar question was posed to him. I know he has sponsored a lot of students into Ejumaku to learn this Ghana language to be taught in our schools. As to how they can deploy these teachers is another matter. So an answer to your question, Mr. Chairman, is that quickly, Ghana Education Service and the Minister for Education, we need to sit and look at what we can all do collectively to ensure that our languages are taught in our schools. Surprisingly, I was taught by a Akan teacher, Ghana language in Chudasi Primary School, Mrs. Osafo Babing. Impeccable Ghana, she taught me. And that has run through. So I don't see why we have available Ghana teachers in our schools and they're not being given opportunity to teach. So I think that clearly, Ghana Education Service, the assemblies, and the Ministry of Education would need to have what achievement. Mr. Chairman, Honorable is right. I've been an active footballer. I played for Temahas Babies. I played exemplary, Joado, Shamokwe, and the likes. I end up in the premiership in Afinia Uni, 94. So you are right. It's an oversight. Thank you very much.
Okay. They are urging me to ask something about Shatawale. They want you to give us a Shatawale song.
I was a better player. You should sing Shatawale song. Mr. Chairman, you should sing Shatawale for us.
Anyway, my brother, Mr. Chairman, I want to find out from my brother Titus whether you have any blueprint to promote tourism in the region, especially the beautiful culture and then the festivals that we have in the region. I want to find out if you have some blueprint in promoting that.
Thank you very much. Mr. Chairman, yes, indeed we have. When you look at the Gadangbes, we have 3 core festivals that we celebrate. From Tema to Pong to Bubla. Between the latter part of March or early April, look, depending on the traditional calendar, we celebrate what we call the Korle-Bu Festival. And this Korle-Bu Festival heralds the Omo Festival. Then we have the Asafotufia by the chiefs and people of Adan. That's the first Saturday of August. Then we have the Omowo, but the Nungwa traditional area, they start the celebration of the Homo in early August. So clearly, these festivals that we have, I recall during my days in the house, there are a lot of my colleagues, my brother, Honorable Nilante, my brother Henry Korte, Patrick Buama, Muntaka, and a couple of them that I took them to Tema Korle-Bu Festival. I'm sorry, Honorable, you are part of it, I'm sorry. That because I wanted them to see the rich culture of the people of Tema, the way we celebrate the Korle-Bu Festival in Tema, in Bublan, and in Bung. So clearly, the festival in itself, it is something that we need to market. And during my time, I spent a whole lot of money to market the festival of my people. Then you look at the monkey sanctuary in Shah Hills. When you drive on the way to Akosomo, you see the monkeys ride on the road. When you go in the reserve, there's a few things that have been done by the tourists, the Forestry Commission, and all that would need to really market. Today, social media is the power. They drive most of the things that we do. So in the region, apart from the monkey sanctuary that we have in the Shah Hills, we have the Kwame Nkrumah Mausoleum that has been reconstructed, courtesy to the government that we've done. We need to come out with a lot of things that we can do. Unfortunately, in this country, we don't do a lot of travels to know what we have in our country. We prefer to go outside the country to go and spend our goodies and monies for tourism than to promote our own. So clearly, to answer your question, what I think we need to do in the region is to liaise with the Ghana Tourism Authority, with the Ministry of Tourism, and the various assemblies, and see how we can package these festivals for our people. Thank you.
Mr. Chairman, my last and final question. It's just an observation. The outgoing or the outgone minister, your predecessor,
actually collaborated very well with the various assemblies in making sure that Accra had some discipline and some, sanitation issues also handled in Accra. I don't know whether you are going to maintain the same posture or you want to deviate completely from it, because I have observed that if you leave it to the assemblies, I suspect that the momentum that the outgoing minister was able to gather will dissipate in no time, and they will not have the full effect of what we want. So I just want to find out from you whether taking cue from your predecessor, even though you don't have the belt that he has, but I believe that within you, you have the inner strength to push for that.
Mr. Chairman, I raise objection.
Oh, objection in terms of what? Okay, I'm just restructuring my question. I just want to find out, or I just want to make application to you that as much as possible, just look at your predecessor and his style of leadership and then see if you can put yourself in that mode, and then make sure that the discipline and then the sanitation issue that he was able to handle in Accra, you sustain it and push further so that we have a clean Accra.
Mr. Chairman, this advice is well taken, and kudos to my brother and predecessor. Let me once again commend him for that leadership that he provided in the region, bringing everybody on board, and to make sure that that program called Accra Must Work Again was really, really important. Sanitation is killing us. Medically, financially, it is so bad. So I think that's what he started. I can assure you that will continue. Thank you.
Honorable Podo.
My preliminary question. Yes. I've looked at your CV. You have written here that you speak 9 different languages. English, Ga, Dangbe, Twi, Fanti, Awin, Sefwi, and Chokosi. But outside this room, there is another language you and I speak. Why haven't you included that one?
Mr. Chairman, it's a very legitimate concern. My mother is sitting right behind me. My roots, part of my root is from the Volta region, particularly in Jelokope. My grandfather, maternal grandfather's mother is from Jelokope. Unfortunately, they didn't take them home, even though my mother could speak pure Anglo and Pedome. Because we are Gans, she normally preferred to speak the Gan language with us. But the other is in me. So I've started going to tutors so that they'll teach me the other. Thank you.
I'll urge you to improve upon it. Mr. Chairman, we want to talk about this indiscipline in the city of Accra. There is a menace. Chairman lives in Adenta. I also live over there. Between School Junction and the new Games Village at Boteman. Yes, very beautiful road done over there. Can you allow me to ask my question? But you find cattle and sheep heading along the line, to and fro, every time you drive along that road. And the road has just been done, and there will be a lot of passengers or motor vehicles moving on it, especially during these All-Africa Games. What will you do to reduce the menace or stop it altogether? In addition to the cattle, you also have people with mental disabilities hovering around in the cities, in the city streets. Then your predecessor talked about stopping Boye from plying the main road, but it's still there, creating a lot of problems for motor vehicles, and we are having lots and lots of accidents. I had one most recently. So yes, I did. They told me that you didn't include those vehicles. So what will you do to stop this menace?
Mr. Chairman, thank you so much. I think the challenge is about the inaction of the various assemblies. I recall when we were kids, when the assembly was called Accra Tema City Council. At the time, in Tema, you know, it was a model city where TDC, in collaboration with the council at the time, they move around the community and catch all stray animals, goats, sheep, and all that. And they send them to the animal husbandry around the Agric, around Botima area. So when you go and you're able to identify your goats or your dog, they find you and pay a fee, and you take your animal away. And make sure you keep them in-house. These days, we don't see some of these actions of these assemblies. So to assure you and the committee, one of the things that I want to deal with is about the nuisance of these stray animals in the cities. Right last week, Saturday, I went to visit my old one. About 4 cows with sheep, no headman. They were just going like that. Just like that, side 10. He went and bypassed us all the way. We don't know where they are going. So I think that if you are MMDC and you are listening and watching me, you got to sit up, because we want to make sure that the right things will be done. Thank you very much.
Have you addressed all
the issue about the mad people on the streets? It's unfortunate that people with mentally challenged, people with mental illness, when they are assisted and cured, so to speak, by the hospitals, integration with their family are also being a problem. So once again, there should be some liaison between the hospital, look for their families, and see what best we can do and get them out of our street, because it's not healthy. It's not only that one, Honorable. Those you see these young children at every traffic lights, these guys are not from this country. I'm told they are from the Sahelian countries. And you see them walking around, crossing the road, and if you're not careful, they can be knocked down by any vehicle with no fault of this driver. I think that the Ministry of Gender, Children and Social Protection need to be brought on board. Social welfare, we need to bring them on board, including the assemblies, so that we see how we can be able to move these people from the streets. Thank you.
Sending a notice to Boye people as well?
It is one of the model that was instituted by my brother, the Honorable Regional Minister then. And the work it's on the assemblies. He can sit in RCC, and every morning as a big brother has a cane in his hand to make sure that chief executive are working. So if they are here and they are watching, and those who are home are watching from the screens, I want to tell them that they need to sit up, because I will make sure I will make sure that the right things will be done. No compromise. Thank you, Mr. Chairman.
Chairman, my last question. I think Greater Accra has 29 districts, right?
Rightly so.
Okay, so it's a very big region. There are some regions which have only 6 districts. But it's government policy not to appoint a deputy for all regional ministers. Oh, yes. So the question is, how are you going to be able to monitor, evaluate, and manage all these 29 districts alone? What's your work rate?
Thank you, Mr. Chairman. So long as the MMDCs can assist me and be proactive in their delivery, I'm sure they will all assist me to make sure I'll be able to deliver. Thank you.
Congratulations once more, and I wish you the best.
You're done. Yes,
Thank you. Thank you, Senior. Thank you, Chairman. And congrats to my big brother on this elevation to the office of Regional Minister. Yes, yes. Elevation, yes. Yes. Mr. Chairman, you were concerned a bit about facilitation, coordination, and all that. And, Senior, you have given us the fact that if we give you the nod and you become the regional minister, the wonderful things that you do. All these things also require money, funding. And I know very well the handicap that is bedeviled your office. How are you going to work closely with the zonal councils and MMDAs and so on to be able to achieve the kinds of things you are talking about in the face of this financial challenge that is rightly facing you? Thank you very much. Mr. Chairman, unfortunately, the zonal councils and the sub-districts are being supervised by their respective assemblies. My duty is to make sure that these structures are active. But here again, it's all about money. Two sources of funding to the RCC is the GOG funding and the Disassembly Common Fund. So the delay in the release of these funds can affect our monitoring and evaluation purposes. So I think that there's a lot that needs to be done. And I'll make sure I'll engage the DACF administrator and see if she could be of help, because Greater Accra is Ghana and Ghana is Greater Accra. So there's a lot that we can do together and to make sure that all these things can work very well. But all the sub-districts and the local councils are within the purview of their respective assemblies. They should be proactive and to make sure they're active. But let me add this. I think in 2018-2019, the 13 municipal assemblies that were created, the act didn't capture their sub-districts. So I think that, God willing, with your recommendation and approval at the plenary, when I take over, God willing, I'll be liaising with the local government ministry and see how we'll be able to make them legitimized and make sure. Thank you very much. Submit to. Thank you. Mr. Chairman, my last one. Ordinarily, I mean, you as a regional minister would not have to be seen to some of the pettiness on the ground. But when everybody gets to Ghana, from all the regions, they come to Accra, it's the regional minister we know. There's a creeping trend, particularly sanitation with our foods, the vendors, create lots of problems. And the nominee that came before you, the health minister is concerned about all this, particularly in the area of hygiene. Regarding our foods, how are you going to ensure that Ghanaians live in an atmosphere where we can have better commercial foods? I mean, since Accra is more commercialized than any other city, probably we can talk of in Ghana. Thank you very much. Mr. Chairman, this is a very legitimate question from the honorable member. Surprisingly, where they sell these food on the streets, we don't look at where the food is prepared and brought to the streets to be sold. And it's a challenge that we need to look at it. And that is the duty of the assemblies. I recall there's a gentleman when called McLean. He was a very active and hard sanitation officer in TMA. When you hear McLean coming, you have to run away, because you make sure that your home is tidy and clean. He goes to the place where people are cooking and look at the environment. Because before you can bring food outside to be sold, we need to look at the place that you are preparing this food. So the assembly have a role to play. The health directorate have a role to play. Even a local assembly member and the unit committee, that is where it's their work. It is their duty to make sure that all these people who are preparing food to the public are clean, the environment is tidy, and even the kind of food stuff even they prepare in the meal for us is always taken care of. And when they bring it to the roadside, we will see and make sure they are done. So I'm in line with you. The concern is very legitimate. Yes, again, the assemblies have a duty. The health directorate have a duty. They need to move around and find out how these food are prepared. You go just behind your side where you are selling, and there's a drain there. It's choked. So filthy, it's not clean. You need to be punished. Because when these flies feed on I don't want to describe it because it's evening, and they land on your food and they spill all these diseases into the food. That is why it's creating a lot of health diseases for us. Financially, it gets into your pocket. Government is struggling to get medications to treat patients on our street. But we can do preventive health care to make sure we save some money and invest in other things. So clearly it's a major concern that I think that I can liaise with my assemblies to make sure they do what is needful. Thank you.
My last one.
Yes.
Last one. Honorable nominee, one challenge that I have found is not the issue of political interference. And as I see behind you, and even the guns are, everybody is your relative. And you are
these matters case by case. But we need to instill discipline because people have relaxed too much. And because of this laxity, it is continuing to contribute to these problems that we face in our hands. So we'll look at it case by case as and when they happen. But if there's a need to crack the whip, we'll crack it.
Okay, yes.
Thank you very much, Honorable Chair. Ni, congratulations.
Thank you.
Looking at your CV, you have a number of languages there you are quite fluent. And Accra is a highly cosmopolitan area. How are you going to use all these languages to leverage to ensure that you could reach the people and that could make your work a bit easier? Thank you.
Mr. Chairman, fortunately for me, as a Gadangwe, I don't have a problem. I speak fluent Twi, Fante, Awing, Seshi. Chokoshi is similar to Awing and Seshi. Mostly you don't see them here. You see them one, just few. But the accounts are generally here. And communicating in their language wouldn't be much of a problem for me. If there is a need to meet, these groups have come up with some traditional leaders within the locality in which they operate. If there's a need to identify myself to some of these people to help in the discharge of my duty, I'm able and willing to meet them to assist me in the discharge of my functions and duties. Thank you.
Honorable Chair, my second question to my friend and brother. Honorable Kwate, if you walk through the Greater Accra region, you have a lot of properties. We have huge markets. We We have huge commercial areas as well as residential. And with your background as a labor person and also an internal auditor, how are you going to ensure that IGF is improved tremendously to facilitate development in the Greater Accra region? Thank you.
Mr. Chairman, this question is so important because the assemblies need to generate revenue, and property rates, it's one key area that they can make good returns for it. A typical example on top of my head, when you go to Tema West Municipal Assembly area, you look at Bachona, all the way from that stretch, all the way to Coca-Cola, you come to Committee 18, Committee 19, Committee 16, and the development in this area are so huge. You come to Santor, you go to Ajekojo, beautiful buildings that are put up. The question you ask yourself is, these people will be asking central government and assembly to provide certain services, i.e. roads, water, security, and whatever. If you don't contribute in the payment of property rates, how will these social services be given to you? So I think that clearly, I know the RCC have done a lot. I look at the handing over notes of my predecessor and see how we can do collectively. Because I remember in the 6th Parliament, the GRA, there's an act that we passed that GRA is collecting these property rates on behalf of these assemblies. They will take the 30% and give the 70% to the assembly. But it's not forthwith. It's not coming. So clearly, it is really stifling the assemblies of raising revenue to develop. So I think that we need to look at this act again and see how we can make a reversal and charge the assemblies, get a right valuation of these properties so that we're able to make some good money out of it and channel it into the proper social services that we can do. So your question is so legitimate, and I think that it is something that we're considering. Thank you.
Honorable Chair, last one. Accra Medina Abri Road. Few years ago, there were demonstrations here and there to get overhead bridges so that individuals wouldn't stand the risk of crossing the roads to have some motor interaction. Honorable Henry Korte did a lot getting service personnel there. But as Ghanaians as we are, the uniformed men are not there, and interruption of traffic due to pedestrian activity is getting too much. So, Honorable Chair, there's an appeal. I will appeal that you put measures in place to ensure that they use the bridge because they're expensive and save the motorists the risk of knocking a life down. Thank you very much.
Mr. Chairman, advice is well taken. Thank you.
Very well. Yes, Chief Whip.
Thank you, Chairman. Many congratulations.
Thank you, Honorable.
Thank you for your Christmas card in December. I can see on your CV you like jazz music. Which is your favorite jazz artist? Shetawale is not a jazz artist.
I've missed it. I've missed it.
Okay, I can see you cook. Cooking is also your favorite. What's your favorite meal? What's the best meal you can prepare?
Partly away in Ghana, I can cook all kinds of dishes, but Banku and Mengmami flour is my favorite.
Okay. I'm sure that works for everybody, actually. It works even for a speaker. Okay. You are going to be the coordinator of activities, government activities in Accra, our capital city. I see one of the problems we have in Accra, whether it's waste management, traffic, as a planning issue. In the industry, people say that if you want to know whether a country is disciplined or a city is disciplined, when you are landing in the night, it will tell you whether they are disciplined. And as a matter of fact, when you are landing in Accra, nobody will tell you that when you land, don't expect any discipline, because it appears everybody is just building anyhow. If somebody wants to put up an estate in Accra, what role does the regional minister have in terms of determining the planning regime?
Thank you very much, Mr. Chairman. One of the key functions of the regional minister, who is the head of the regional coordinating council, involves planning, because we need to supervise that the right planning with the special planning units or departments of the RCC, because from the various districts and municipal and the metros, they report to the regional directorate, and to make sure that they conform with the special planning that they have. Should they go contrary to some of these things? These are some of the things that develop in these problems that we find ourselves into. Regional directors need to have the tax. We need to make sure that every bit of this planning that is brought before them are really adhered to. Because when you relax, when you feel comfortable in your seat, you don't move around. Because people get these reports and they put them on their table, or they even hide them in their cupboards. They don't work on them. So clearly, to address this problem, these directors that I'm going to work with, special planning, all these people, we need to make sure that the schemes that have been provided are religiously followed into, and to make sure they have some discipline around the place. There's a lot of slums that are springing up all over the place. Encroachment and laggards. People are doing all kinds of funny things. So I think that with the advice of the chief director and the technical people, personnel at the RCC, they are going to support me to make sure that we put the right things in place to better some of these things. Thank you.
Actually, it's not only slums that are creating problem. I don't know if you know where the Wawi building is in Cantonment. At the T-junction, ahead of the T-junction, is supposed to be the official residence of the Vice President of Ghana. Where the current Vice President stays is not actually, I think it belongs to Cocoa Board. But they are stuck there simply because we are unable to complete that. And part of the reason they have abandoned that as a residence of a Vice President is because the same government, the same state, has granted permission for the Wawi building to go up, looking directly into the bedroom of the Vice President. And then the other side of Wawi building is another one going up. So effectively, the state, exactly, the state cannot use that for the official residence of. So everybody keep asking. So the investment that has been made in that building, what are you going to use it for? So I think that we can talk about the slums, but Cantonment is not different from a slum. The fact that there's a building with a glass or a high wall, you go through Cantonment till now. You can go through some streets, and after the gutter, it's right that somebody's wall. So even in Cantonment, the planning regime in Cantonment is even not fit for purpose. As a regional minister, what are you going to do to ensure that the assemblies that are working under you don't just go granting permission? Because you see, they are happy to approve anything for those developers, because those developers bring in a lot of money in terms of the planning fees and other things. So they just grant it. As a regional minister, what will you do to make sure that we enforce the planning regime in such a way that it works for everybody?
Mr. Chairman, what the leader said, I know he's a professional architect, so he really understands this job better than I do. But his concern is basically about how to ensure that planning schemes are really done properly. To some extent, I also blame the national security, because if we have the residence of the vice president there, and national security knows very well that this is where the residence of the vice president is, under no circumstance should they allow for that edifice to be put up in the first place. So this has already been done, but going forward, what do we do to ensure that future high-rising buildings, particularly where you have, you know, for the want of better words, are really properly done to make sure that they don't create any nuisance or any problem for us in the future. So I can assure you that all these schemes that are coming, provided they come under my attention, once I will move around. And my brother sitting there, he doesn't sleep. I know. He moves around the region to make sure that things... No, it's not Amram Robert. Just to make sure that before things are brought to his table, at least you have a fair idea of whatever is going on. I have my VALCO staff behind me here, and they can tell you the way I operate. If I want to do something, I take my time and I do it and do it well. I can assure this committee, trust me, that I will make sure that the right things will be done in the region. Thank you very much.
Okay. The other people have some issue. Currently, wherever you live in Tema, for instance, you will have the local assembly collecting money from you. They call it property rate or something. Then you have to go and pay a waste management company to collect your litter, actually. So people keep asking, the money the assembly collect, exactly what do they use it for? Because you take that money, then you need to either employ Jacora or Zoom Lion to collect your bin. So what does assemblies do with the monies they collect from the landlords?
Mr. Chairman, what I know of is that the assembly hasn't got the capacity to collect these refuse in our homes. They have given to private people to do it. It's on record that they are not regular in their collection. Sometimes payment becomes an issue. They will collect on behalf of the assembly, and the assembly have to... I've been an assembly member before, and those days in Ashibo electoral area, before these contractors are paid, they come round, because I have a book. Anytime refuse is collected in my electoral area in Ashibo, I record it. Anytime they miss, I record it. So when you come, I will do a checklist, and you find out the number of times that you have come. And sometimes when they come, they fight me. I say, look, so long as you have not delivered, there's no way I can make that recommendation. I will make sure we take it off. So I think that the assembly, in as much as they have given to the private people to collect, the monitoring is key. How are they looking at these things? The chief executive cannot be everywhere. That is why you have the assembly members, that is why the union committee members, to support the assembly and to make sure that these refuse are collected on time. So when they are collected and the work they've done, we should pay them. And when you pay, because running cost is so expensive. Thank you.
My concern again about waste in the city. Indeed, there's some level of improvement in the cleaning of the city. But one problem you find is that the companies that collect the litter, sometimes in the process of conveying it from wherever they take it from to wherever they're supposed to take it to, then they dump it somewhere else. What is the solution to this? Because your aim is to actually relocate it to where it can be recycled or disposed of appropriately. So your aim is not to move it from one location and dump at another place. How are you going to deal with this?
Mr. Chairman, I think that the bigger waste management companies are doing so well. And with all respect to Zoom Lion, we need to commend him for what he has done. With that facility, he has put a mudo where the collection of these wastes are sent to, they are processed and all that, then around the Amasaman area. But I think that the challenge is about those doing the Boye stuff. And that is why my predecessor brought this idea that no Aboboya should ply on the motorway, on the highways, because they collect these refuse, they collect monies from these residents, and they watch left, they watch right, and they dump it anywhere. And that is the issue that we need to confront ourselves with. So I think that we need to really be up and doing and to make sure. And the issue about these Aboboya guys plying the highways and the motorway, we need to revisit it. The police need to assist us and to make sure that the motorway is clean. You see a whole truck, sometimes these tricycles littered all over the motorway. And it's an eyesore when you see, visitors plying on the motorway, Tema and back to Accra with all these refuse lined up on the street. It doesn't augur well for us. So I think that, again, the duty and the tax is on the shoulders of the assemblies to assist us. The motorway is not only Tema Assembly. Depending on where you are coming from, when you start from the Tema end and heading towards Accra, on your left is Tema Metro Assembly. On your right is Ashaman. When you cross Kragon underpass, it's Tema West. You move from Tema West, then you go to Krowo, then you go to Lejekuku, you end up Ladadeko Topon. On your right from Ashaman, part of Tema West is there, then Adentang. Then Ayabaso West Wogon. So on the motorway, you have about 6-7 different assemblies that are stretched. But sometimes when they are given a description, it is Tema Metropolitan Assembly that is attacked all the time. We need to make that distinction clear and to make sure that all these assemblies in these corridors are doing what is right. Thank you.
Chairman, my last question. The problem of noise in the city. And when I say noise, pollution, because noise is unwanted sound. And then light, pollution in the city. Is there any unit under your purview that determines what level of noise you can make within certain places at certain times?
I know EPA, they are mandated to handle issues of this nature. We need to liaise with the EPA actually to find out, because noise level in itself is a nuisance. Somebody is tired, he has gone to work, come back, want to have a nap, and next door you see a pub with the noise up and creating all kinds of nuisance, making him difficult to sleep. So I think that here again, the role of the assemblies is very key when it comes to management of some of these nuisance in the assembly area and all that. What we need to do is quietly invite these operators of these pubs and these people, you understand, so that at least we need to engage. First of all, before you can make some punishment, you need to engage the person. Let him know that what he's doing is a complete nuisance, is against the bylaws of our assemblies. When you engage him and let him know what he's doing is a nuisance and is subject to punishment, and he goes 1 or 2 and doesn't heed your advice and you are punishing him, I think it's fair for everybody to understand. So I think that some education needs to be done. We need to look around those noisy areas within the catchment areas of these assemblies. That is why they are there. And we'll make sure we'll be able to resolve some of these things as and when they come. Thank you.
Honorable Titus, I wish you very well. But with regards to Aboboya, I would just urge you to tread cautiously. Because the motorway is not the only place they use. I know that if the big waste companies were collecting the waste appropriately in every corner, there will not be the need for the Aboboyas to exist carrying that. So I wish you well.
Thank you very much, Gomez.
Yes, Deputy Leader.
Honorable Titus-Glover. Papa.
Can you provide the translation for us, please?
Yes. Mr. Chairman, he spoke in Zuma. He's asking me how I'm doing. And I said, I'm fine.
Well, Chairman is asking whether you can pronounce 8,880, but I'll caution you not to. I'll caution you not to. Congratulations.
Thank you, Senior.
Yes, and I also see that you, in the delegation with the renowned chiefs, includes my good friend, the Lion, Honorable Afoteagbo, the paramount chief now.
No, he's the regent of
The regent of Katabanso. I saw Mr. Bernard Mona. I don't know whether he's also been crowned a chief somewhere. I don't know.
He's not the one.
He is. He is. So I don't know whether he has captured Mr. Bernard Mona, I don't know whether to call you a chief or, but you're welcome.
Nana Bernard.
The Chairman, Bernard is a kingmaker in Sankana. You know, I'm a development chief. In April 2019, I was installed as a development chief in Sankana with the student name Siambogna, the king of the caves. So he's here to represent the Sankana and the traditional area. Thank you.
So, rep of the Sankana, you're welcome. Honorable Titus, you are just exiting Ghana's sleeping giant, Kwame Nkrumah's VALCO. Is that correct? That holds the key for employment that we are struggling with. As we speak, we still continue to import alumina and export our raw bauxite. Nothing has changed. We are struggling with power. The 5 ports are not functioning. I don't know, we are approaching 2, maybe 1.5, struggling to pay the electricity bill. And so the potential of VALCO is still there. Now, you are leaving VALCO. I'll let you tell us what you see as the footprint you left there. And while you are at it, tell us what the solution is with VALCO's use of electricity. There's this argument that after 1960, we should now focus attention and allow legacy hydro to be dedicated to creating jobs. Now, I understand that we need almost 700 million to invest. Give us what you see as the solution to making VALCO the viable job-creating magic that we've all been praying for.
Thank you very much. Mr. Chairman, this will take me quite some time, but I will be a bit snappy to make the answers to the committee. I agree entirely with my senior what he said in terms of the performance of our plant. Since Kaiser left and Ghana bought the shares from Kaiser and Okoe during the days of His Excellency President J. Kufuor, VALCO has not been what it is. I can say that the prospect is still there. Currently, with all the challenges that we have, we are producing with an obsolete machines, 1967. Naturally, the cost of production will go up. Alumina, 80 to 85% of our raw materials are imported. Alumina, fluoride, carbide, silicon, what have you. We import all these things to develop the cells and to produce the aluminum for us. You have equipment that are old. You cannot control the London Metal Exchange market because just like cocoa, gold, and oil, for every ton that you produce, you are losing between $2,900. As of December, we are losing $3,000. And you go to the LME market, as we speak, as of yesterday, the brief I had from my finance director is that the LME market is $2,100. So for every ton, you are losing between $900 and 1,000 tons. So what is the solution? The solution is value addition, where you can add value, because currently most aluminum smelters, they have value addition attached to their plants, where they add value to these things. There is a model that I have discussed with my management and we have agreed. God willing, tomorrow I'm going to share with my board. And for the sake of this committee, I just want to say some few things. One is about the use of the power, how we can reduce energy consumption. And natural gas is very key. Central Oil is just at our doorstep. We get them right of way where they buried most of their pipes on our land, right away into the refinery. We're going to do a project where we're going to do a tie-in where we'll connect gas from Central and link it into the carbon bake, the boiler house, and the green carbon, where we're able to reduce the consumption of akosombo. We're going to use what we call the scrubbers, where we tie them also into the cell lines, because the rectifiers are so old, and every day the cost of producing electricity is also expensive for us. We want to invest also in populating the cell lines. As we speak now, we are doing 2 lines, but in total, it is 117. What do we do? So clearly, we have thought that, look, there's a way that we can look at these things and to make sure that VALCO can stand on its feet again. I have a wonderful board of directors. I have a great board of directors headed by Dr. Henry Benya, with all the support they are giving me, and the management that I have, the directors and the management and the workers. The most important thing in VALCO today is about industrial peace. And I can say that today, when you walk into the VALCO plant, the place is as peaceful as anything, and we're doing our best to make sure we turn things around. So we need the support of Parliament to make sure that we're able to turn things around. VALCO looks good. Gradually, the enthusiasm is there. The workers are working so hard with the right support. And we are able to reduce the cost of our production in terms of our machinery. I'm sure that we're able to turn things back to VALCO and continue to give some adrenaline to the people of this country.
You see a future of VALCO, you have all these nice plans, and you want to leave it to go to Greater Accra. Let me give you a picture of where you're going. We are talking about a city that is basically engulfed in all sorts of problems. Sanitation, water. In fact, the Ghana Water Company says 20% of the residents of Accra do not have water. We have problem of housing. Sanitation, you know, the president said he was going to make Accra the cleanest city. And I'll leave that for you to judge if he has been able to achieve even 5% of it. Sustainable urban development is really the key. And so as you leave all the vision you are drawing, and you couldn't pinpoint your achievement for me, what will you do there? But talk about that, and then talk about what your plans are for sustainable urban development to change Accra in this short period of time you have.
Mr. Chairman, if you want me to share with you some of my achievement, I can share with you. But for the sake of time, I'm looking at the bigger picture, the bigger responsibility that His Excellency the President has given to me. Yes, it's a major challenge. The time is so short, but my prayer is about the impact that I'm coming to make within this period. So I can assure you, Senior, that there's a lot that we can do together. And if you have some ideas that you can share with me, I'm ever ready that you can bring it on board so that we're able to solve the problems in the region. After all, you live in the region. And if you see something that is going wrong,
we all live
of course, you can share with me so that I'll be able to deal with it. Thank you very much.
You also wore the cap, the former Deputy Minister of Transport, and I'm quoting you from some newspaper source. He says that the Deputy Minister of Transport, Nominee Titus-Glover, has cast salt for the reconstruction of the Chemu Lagoon, 7.5 million, which is going to be funded through the Ghana Post. What is the state of the Chemu Lagoon today? Where you got the...
I recall this. That was a project funded by Ghana Ports and Harbours Authority. That was a time when I was the MP for Tema East. And it was a desilting that they did. And they did, you know, the Chemu.
What is the state of the Chemu Lagoon today?
Chemu, the aquatic life is bad. It's gone bad because all the industrial wastes are channeled through the Chemu into the sea. You have Temor Refinery, you have Lube Oil, you have Lever Brothers. Everybody, they all channel it into the Chemu Lagoon. And it has gone bad with time, you know. So there's no fishing activity. I recall my granny tells me anytime the off-season of fishing, that is where they go and do most of their catch. But today it's gone because of industrialization. The lagoon is entirely polluted. There's no aquatic life. We can only do this if we're able to dredge and allow fresh water to go through. And if these industries can treat their wastewater very well, we'll be able to bring back aquatic life into the Chemu Lagoon. Thank you.
The last one, and I'll leave you. No, I'll finish. Land guardism. It's a big problem in the Greater Accra region. And you know we have a law against it, the Land Act at 1036. But that has been stated. It came with all the chiefs, landowners, some of your friends, some of your family members. How are you going to assure this committee that you are going to enforce the laws of Ghana to make sure we all know that land guardism is illegal?
Mr. Chairman, this is a security matter, and I will not be able to share security publicly. But I can tell you that the RCC and the Regional Security Council will look at these. The handing over notes, I know where these flashpoints are, and we'll be able to look at it and deal with it accordingly. Thank you.
But I want you to agree with me that land guardism, as has been stated in Act 1036, is illegal.
Mr. Chairman, my senior knows.
All right.
My senior knows.
Public knowledge. The law was passed.
Mr. Chairman, Missy.
Honorable Deputy Leader, Majority, you are asking.
All the best.
Thank you.
All right. So,
maybe just
ranking.
Titus.
It's Titus-Glover.
We've had a very long day today, so I won't be very long. I'll be quite brief. There is a worrying trend, very worrying trend, particularly when you are driving through Accra traffic intersections, where we see a number of children who ought to be in school, but obviously are not in school, and they are begging for all sorts of assistance, money, food, and so on. I am worried as a Ghanaian. If you are to be given the opportunity to serve as a minister responsible for the Greater Accra region, where this is becoming a major concern, what will you do to stop this practice?
Mr. Chairman, thank you very much from my leader. If you study this problem carefully, you notice that majority of these children are not Ghanaians. You realize that their mothers are sitting just across the road, and they will send these poor children to be begging for money at the risk of their lives. It's a major concern. So I think that there should be a collaborative effort between the RCC, the assemblies in those catchment area, the national security, to identify the nationality of these people, and their embassies need to be brought into the picture. Yes, there will be few Ghanaians that will go on the roadside. Some are blind people holding their walking stick, begging for money here and there. But generally, most of these people are not from this country. So what do we do? And the question you asked me is that the collaborative effort with these institutions, my assemblies, the gender ministry, the national security, and their respective embassies, we need to bring them into the picture so that we can see how we can deal with this problem. Thank you.
Honorable Titus-Glover, the parents of these children may be foreigners, but the children born in Ghana, live in Ghana. Don't you think the state has a responsibility to take care of these children?
I agree with you, but we are competing with needs. We have competing interests. I agree with you. But the most important thing is that how do you move these people from the streets? So clearly, we have a Herculean tax. Their embassies must equally contribute because they are sending their children to the streets. If it means taking them back to their home countries, we should do it.
No, but the regional minister must also be concerned about it. The matter is within your region.
I mentioned gender ministry, social welfare, the national security, and their respective embassies. We need to bring them into the picture.
So what will you do?
It's a matter of liaising with these agencies and ministries to help me.
So are you saying that you will liaise with the MP?
Absolutely so.
Then put it well. What
Absolutely
you
so.
will do.
It's
I
a
want
matter
to
of-
know what you will do.
Mr. Chairman, I did say that I will liaise with the gender ministry, the social welfare, and their respective embassies to ensure that these people are taken away from the streets.
I know the former minister is here. Work with him. He will show you what he did, whether he succeeded
Leader.
or not succeeded.
Thank
It's
you.
for all of us to see on the street. Another question. Kayaye. And most Kayayes, you know, they sleep in the open. Sometimes outside the shops after a hard day's work. Your government, through our Vice President, Dr. Haji Bawumia, promised to provide them with hostels and toilet facilities. Can you tell this committee the status of these hostels and toilet facilities that your government promised?
Mr. Chairman, I don't have any information on this particular subject. So with your support, when I'm able to say through successfully, the handing over notes will show the extent of work that has been done in this area, and you see what we can do. Thank you.
I will ask my last question for the night. My last question. I promised 3 questions then. This is my last one. Honorable Titus-Glover, the Sakumono Ramsar site has come under siege. And we know that certain individuals shared lands there among themselves. And it is public knowledge. Once upon a time, somebody is on record to have shared the Ramsar site and willed it to their family members. I want to find out from you. Can you tell this committee how you intend to protect the remaining lands around the Ramsar site? Ramsar site. Ramsar site. I'm saying that it's a public knowledge, and people had made statement. My concern is how will you protect the remaining Ramsar site, knowing very well that Ramsar sites are kept for a reason, for environmental reasons. I'm more concerned about the environmental impact of the Ramsar
Mr.
site.
Chairman, thank you very much for the concern of the minority leader. I feel quite worried when people deliberately use large trucks of soil and sand to push the river or the lagoon just to claim part of the land. Sometimes they forget themselves that the nuisance that they are creating is going to create damage to people's lives and properties. Growing up in Sakumono and in Tema, we come all the way from Community 1. We go to Community 6, you go to Community 10, Community 12. Those days, Community 11 and 12 were not there. That's why we went to do some fishing. Today, the indiscipline of people who have deliberately pushed this lagoon in the name of encroachment, and they are selling these lands for God knows how much. I want to assure you, Mr. Chairman and the minority leader in this committee, that I know my predecessor has done great work in that area. As part of the handing over notes, I'm going to study it very well and to make sure that we'll be able to protect aquatic life. Somebody will say that, yes, birds are coming around and human beings don't have anywhere to lay their heads. What is gone, we should protect it. But what is remaining for the aquatic life of these lagoons, particularly the Ramsar site, we'll do what we can with the support of my chiefs to sanitize these areas and to make sure. Thank you.
All right. Thank you. I'm tired. I've listened a lot. I'm satisfied that there's nothing more to ask you. You have brought me a long list of people I should recognize. You know, from 2021, this parliament decided that no nominee is entitled to more than 5. Now, we have overlooked and you have over 100 people behind you, but I will not breach the rule parliament took. So out of the list, I'm picking the chiefs and the immediate family, and the rest I wish all of you, we thank all of you together. So Mrs. Agnes Na Nyoko Titus-Glover, who's your mom, thank you for coming to support him. Adlina Latebia Amoyao Ajidoku, who's a spouse, we thank you for coming to support him. Benjamin Nikwa Titus-Glover is a son. Thank you. Dr. Alex Glover Corti, who's an uncle. All right. Then I have the Ni Abola, the paramount chief of Abola. Nene Name Nime Oyoadon. Nene Waka, the paramount chief of Pram Pram tradition area. We thank you for coming to support him. Yes. Regional Chairman, he has already recognized him. Then the chief of Guma, the Greater Accra Mamprusu chief, we thank you for coming to support him. Then I have Osabema Otudate, the chief of Okoe Mampong. And we thank you for coming to support our brother. Then I have Ni Laye Afote Agbo. Lion. A former very senior member of this house. Then I have Ni Ajete Agbo, the second. Ajete Agbo, Temaman Kralo. Thank you. And then I have Ni Ahele Nuno Abola Manche. Ni Ahele Nunu Abola. we thank you, all of you, the directors from the ministry, party people, regional chairman, we recognize you already. All the others who came to support. Who is the mayor of Accra? Oh, yes. Akole Papa.
A former colleague.
Yes, a former MP. He came to greet us. Honorable Regional Minister, we thank you to, KMA Chief Executive. The AMA Chief Executive, we thank you very much.
Mr. Chairman, I'm also grateful to the committee. Thank you.
All MMDCs who came, we thank you for coming to support the nominee. Honorable members, I can now discharge Nominee Titus-Glover. You will hear from us, of course. Thank you.